guys, it's Kathy. I hope you're doing well. Sorry, I had car trouble. No, I didn't drive here. Irritable bowel syndrome. That's where I'm going with. I start a new job tomorrow, so I was late for court today. My Zoom doesn't work. My lawnmower broke. Are any of these good enough excuses? I'm sticking with car trouble. I had car trouble getting from upstairs to the downstairs. Yep. That's because I just started, Mel. I was late. I overslept. I just overslept. I don't know how I woke up, actually. I woke up a couple of minutes ago out of the blue, and I'm like, oh, sugar. And I live with 4 adults now, my children. And I tell them my stream starts at 4:30 every day. So they should have seen that I was not moving. I see your comments, Twitchy. Yep, check's in the mail. Check is in the mail. Okay, so we're going to the part 2 of this trial for damages. And we're not going to do the whole thing today because it's over 2 hours. So we'll do we'll get pretty far into it, maybe like an hour and a half or whatever. And then we'll go to Judge Fleischer for a bit. Again, the video and the audio separate. So I had to keep bumping it back together. I did my best. I did my best. They don't give you instructions on how to be a YouTuber when you start this job. They don't even ask you to start this job. You sort of just do it. Okay. Oh, before we start, I'm not streaming on Monday. That is the 2nd here. I don't know what it is in Australia. It could be the 5th. But going well. It's going well, Fozzie. Everything looks good. Fozzie got me mesh internet system. And it's good. It's all set up. All 3. Upstairs, downstairs, middle room. So our internet should be smooth as glass now. Is it Jerry Lewis Day? Well, of course I'm not streaming on Jerry Lewis Day. I'll be drunk. Yeah, I'm not streaming on Monday. I'm taking 1 day off. I think I took off in July, so you guys will be fine. Was it July or June? I don't remember now. Right. Easy. All right, here we go. Is that what I named it? Oh, I hope I got the right clip. This is a weird name. Uh-oh, it's thinking. Okay. So this is the first guy that they brought to the stand. And if you notice, if you could see up here, the VLC player, they videoed his deposition. And you could hear the courtroom. But you can't hear him. There's no audio. You can hear the courtroom, but you can't hear him. So we're not going to hear him.
Ladies and gentlemen, you are all jurors in this case. I'm going to tell you now, and I'll repeat this again each time you're permitted to separate. Generally, you should not express any opinion about the case before it is submitted to you for deliberation. However, you are permitted to discuss the evidence presented in this case among yourselves in the jury room during recesses from trial. All jurors and auditors must be present during these discussions. You must reserve judgment about the outcome of the case till your deliberations begin. You're admonished that you may not discuss the facts of the case with anyone other than your fellow jurors. You may not listen to discussions among or receive information from other people about the case. Do not discuss this case with me, the lawyers, the parties, or with any of the witnesses, members of the media, or anyone else. This includes posting information, text messaging, email, internet chat rooms, blogs, or social websites. You should not listen to, read, or watch anything about the case from any source. You may not investigate the case, conduct experiments, or attempt to gain any specialized knowledge about the case outside the courtroom, and it is highly improper for you to do so. You are to consider and decide this case only upon the evidence received during the course of the trial in the courtroom, not from any outside source. You are not permitted to use electronic devices while in attendance at trial, during discussion, or during deliberations unless specifically authorized by the court. This will be your afternoon break. You'll be in charge of the bailiff. Bailiff?
All right.
Oh, Tina, I'm so sorry. Now you're working at home. I would hate that.
Mr. Phelps, any record you need to make?
No.
Ms. Pollock, any record?
No, you're on.
This will be a short one. As soon as they're ready, we'll get back here and get going again.
Okay.
Thank you. Jackson in court in person by his attorneys, Michael Phelps and Ryan Mell. I have the defendant, RGB Sales LLC, in court.
Again, now we couldn't hear the last guy, but we saw the last guy. Well, this next guy they don't see, but we'll be able to hear because some dude they already had a deposition. They already had a trial. They already had a trial to see if this guy was at fault or this company was at fault, and they're at fault. So this is just the trial for damages to that. So the person is just going to read the testimony, I think, from the trial in the record here. Nobody's going to get to question him or anything. They're just going to read it into the record here. So we don't get to see this guy. Anyway, here we go.
By its attorneys, Karen Pollock and Lana Swingler, also by their representative, Aaron Rink. And at defense table, we also have Ms. Pollock's paralegal, Ms. Morris. Mr. Phelps, ready to go?
Yeah, I think we are. I think we just had a quick question on what the court would prefer. I think we're going to end up in a situation where by the time we get done with Dr. Smucker's deposition, it's probably going to be 4:45. We have a live witness ready to go, but no way.
How long is the live witness going to take?
It's probably our longest live witness, maybe 30 minutes, right? 30-ish minutes.
Cross, think will be.
I don't know what he's gonna say, so I don't know.
Or ish 30 a.m.
So we just didn't know if we should send him home, have him come back first thing in the morning, or if we should.
Okay, so let me hear what the game plan is for tomorrow morning. Then, if we send him home,
Yeah, if we send him home, then we'll have. He'll be the longest lay witness. We have 3 other lay witnesses, 2 of which I can't imagine will be longer than 10, 15 minutes each, and then Jeremiah, and then we rest. So I think under either circumstance, we get done with the evidence proper by lunchtime.
you think that's also true? That seems mighty optimistic to me. Mr. Phelps is always very optimistic. I am not. I'm much more. Some
Good
people would say
guy.
pessimistic. I choose to believe that I'm very
Realistic.
pragmatic.
You're right,
Realistic.
Judge. You're right.
What's
Again.
your estimate? I think we ought to. I think we ought to stay and do the witness tonight. What's your thought?
I
Mr.
agree.
Pollock? I think we ought to stay and get him done.
Okay,
Let's do it.
that's fine. No, yeah,
I mean, if
Yeah,
I just think that makes more sense. That ways we'll be.
yeah, he's here.
Then you're gonna still have 4 witnesses tomorrow, which includes the plaintiff, no matter what.
yeah, that's true.
I think we better do that, and then we'll start at 8:30
Okay,
tomorrow morning.
Yep.
And I've given you finals. You can take a
You're welcome.
look at those, and we can make record on those. We get in a little early, make record on those tomorrow. Ms. Pollock, back to you. You ready to go?
Yes.
Let's get the juror back.
Always. Like nothing gets by him.
Bring the jury in, please.
Oh, yeah. Judges, it's okay. Ms. Morris puts the rest of the jury commissioners back wherever they go.
Just put them right up here and she'll get them. Those are mine in the, I don't know what color that folder is. Cross between,
Tangerine.
okay, I like that. It's kind of a cross between yellow and orange. It's the same ugly color in the new courthouse. Underneath the new courthouse.
I knew that topic was coming up at some point.
Oh, you missed it. We discussed it at lunch. Yeah.
Yeah, but that was off the record thing.
We'll keep it that way.
All right.
That's okay. Yes. Oh, she's got it.
You may be seated. Ladies and gentlemen, when we recessed, we were in the midst of the plaintiff's case in chief, their evidentiary portion. That will continue now. Mr. Phelps.
Thank you, Your Honor. We would call Dr. Joseph Smucker by way of reading his deposition, and pursuant to Rule 611, if it pleases the court, we thought we would have Ryan be Dr. Smucker and read the answers, and we'll read our respective questions.
So, ladies and gentlemen of the jury, Dr. Smucker's testimony was taken by deposition.
Deposition.
Everybody will play a part. Mr. Phelps will play his part as the attorney for the plaintiff. Ms. Pollack will play her part as attorney for the defendant. And Mr. Mell will play the part of Dr. Joseph Smucker. Mr. Mell, will you take the witness stand, please?
We have theater. I got you Broadway here, guys. You're welcome.
Mr. Phelps, in reading the deposition, is it going to go through the part where Dr. Smucker is sworn in?
It does.
Then you may proceed.
Okay, and actually, Ms. Polly,
That's okay.
she did direct on this.
I apologize. So the direct will be by Ms. Pollack, still attorney for defendant RGB Cells LLC. Mr. Phelps will be for the plaintiff still. But the order will be changed because it's Ms. Pollack's deposition. Go ahead, Ms. Pollack.
Thank you, Your Honor. All right, Dr. Smucker, my name is Karen. Smucker, my name is Karen Pollack. I represent RGB Sales in connection with an accident in which Mr. Holland was involved with your patient, Jeremiah Jackson. Can you begin by stating your name for the record, please?
Joseph Douglas Smucker.
No, he's not. That's someone else. He just lied. Hi, Donald. Grab some candy for the trial for the theater, guys, or popcorn. I hope this is funny. Yay.
And what is your occupation?
I'm an orthopedic spine surgeon.
Are you a part of a medical group or practice?
I am. I practice with Indiana Spine Group
How long have you been associated with them?
since 2014.
What is your official title there?
Orthopedic spine surgeon.
Are you a partner in that organization?
I am.
How long have you been treating orthopedic patients?
Orthopedic patient since 2004, practicing spine surgery since 2005.
Can you tell me a little bit about your medical education?
Sure. I went to medical school at Indiana University in Indianapolis. Following graduation, I went to Case Western Reserve University for my orthopedic surgery residency. Following that, I went to Emory University for my spine surgery fellowship. Following that, I took my first job at the University of Iowa, where I practiced full-time from 2005 to 2014. I was an associate professor with tenure there. I ran a lab, also had full-time care of orthopedic patients. I practiced orthopedic traumatology and orthopedic spine surgery.
Are you board certified in the field of orthopedic surgery?
Yes.
When were you board?
He can't. He's reading. He's reading the answer from the paper. He's going to read the whole thing and we're just going to sit here and watch.
Board certified.
I believe in 2007, I became board certified. In our profession, you are board eligible. There's a period of time you have case collection, and then following your oral board passage, you then become fully certified.
Can you tell me when you first saw Mr. Jeremiah Jackson?
My first encounter,
That's not Schmucker. That's a body double who's just reading his answers. He's not the real person. He's not like, he's just he's just like Detective Mel something, I think. He's just reading it.
with Mr. Jackson.
Feel free to refer.
Sorry, say that again?
Yeah, feel free to refer to your records.
Yeah, that's why I'm turning my head to the record now.
Okay.
My first encounter with Mr. Jackson was on September 7th of 2018 in my Carmel office.
And how did you come to see Mr. Jackson? Do you know?
Mr. Jackson was referred by an orthopedic spine surgeon in Goshen in Elkhart, Indiana, Dr. Joseph Caldwell from OSMC.
Dr. Caldwell referred patients to you previously?
He has.
What were Mr. Jackson's complaints on September 7th, 2018?
At that time, he was evaluated for neck pain and cervical radiculopathy radiating predominantly into his right upper extremity.
Did you take a full history of him at that time?
I did.
Did you have the benefit of any of his prior treatment records at that time?
I don't recall. I likely did, though.
Do you recall if you had an opportunity to review his prior x-rays or MRIs or CAT scans?
I reviewed an MRI at that time, which was obtained. I'm just looking at a different screen here. In February of 2018, an MRI from January of 2017, as well as radiographs, forgive me, an MRI from January of 2017, and radiographs from January of 17 as well.
And radiographs are just x-rays?
X-rays, correct.
And were they all in the neck?
X-rays that I had at the time included X-rays of the cervical spine from January 23rd,
He probably still got paid for today. You know, he didn't come up.
2017, and an MRI of the cervical spine from January 23rd, 2017. And those were limited to the cervical spine, yes.
Did you have any MRIs, radiographs, CAT scans relating to the condition of his neck prior to this accident with my client?
I'm reviewing my records, but my recollection is no.
Did he tell you of any prior neck or arm pain that he had experienced before the accident?
He did not relate any neck or arm pain prior to the accident.
Were you aware of the incomplete segmentation of his C2, C3, and T1, T2 vertebrae?
I documented it consistently in my medical records, yes.
How did you come to be aware of that?
By review of his images.
Does that incomplete segmentation have a name, doctor?
That's commonly referred to as Klippel-Feil syndrome or failure of segmentation.
Can you explain to me exactly what that is?
In essence, it's a failure of a disc to completely form or failure of a motion segment to completely form. Most commonly, it's a failure of the disc to completely form, which you will often see where the joints or facets, as they're commonly known in the cervical spine, would be present. That there is also a failure to completely form the joints. So basically, two joints, which were meant to be separated and are still adjacent to each other, are immobile and are attached.
Is that a congenital condition or is that acquired?
It is congenital.
Does it cause any type of symptoms in the patient?
Could you repeat the question?
Sure. Does it cause any kind of symptoms in the patient?
In and of itself, it's not felt to, no.
Should someone with that type of condition practice a very physical sport such as jiu-jitsu?
I have no
I do the
recommendation
same
whether
thing.
they should or should not do that.
So people with this condition are not necessarily restricted in their activities?
Not in my practice.
Were you aware that Mr. Jackson regularly practiced and taught jiu-jitsu?
Yes.
And what were your findings after Mr. Jackson's examination on September 7th, 2018?
With respect to what, Ms. Pollack?
With respect to his neck?
I hope to answer your question fully, but what I will say is on physical exam, he had weakness in his right tricep. He had weakness in his tricep on the right side, and that appeared to correspond to the distribution of his arm pain. My findings were also supported by my review of his imaging, which demonstrated multi-level degenerative disc disease and several levels of foraminal stenosis. My concern, therefore, was for the possibility of right-sided cervical radiculopathy as a cause of his right upper extremity concerns.
So it sounds to me when you first saw him and he was complaining more of right upper extremity problems, or am I missing?
He was complaining of neck pain radiating to his right upper extremity.
And you thought that could be related to cervical radiculopathy?
My concern and my diagnosis at the time was cervical radiculopathy.
When you examined him on September 7th, 2018, were you able to confirm that your diagnosis that he had cervical radiculopathy?
He did have cervical radiculopathy, but in addition to that, I recommended a C7 selective nerve injection to understand which nerve or nerves could potentially be contributing to his cervical radiculopathy.
Did you think that he required surgery at that time?
We didn't talk about surgery necessarily as a primary source of treatment.
So can you describe exactly what a radiculopathy is?
Sure. A radiculopathy is considered to be, in large part, a peripheral nerve concern and can be part of a condition in the cervical, thoracic, or lumbar spine. In the cervical spine, it would predominantly affect the shoulder or upper extremity, extending down sometimes, depending on the nerve being pinched, into the hand or forearm. Cervical radiculopathy can cause a variety of symptoms, including pain, numbness, tingling, weakness, concerns with reflexes, and in some circumstances, can also be associated with neck pain, from which it's closely related to disc concerns, joint concerns, or other areas which we would typically describe as foraminal stenosis in the neck.
Is radiculopathy, cervical radiculopathy, does it always affect one arm or the other, or can it affect bilateral?
It can be bilateral.
In Mr. Jackson's case, was it just the one arm?
Predominantly his right arm, yes.
And is radiculopathy something that begins suddenly or gradually?
It's variable.
And is it something that comes and goes, or is it constant?
It can come and go. For some patients, it's constant, but it can have ebbs and flows for sure.
All right. Now, Mr. Jackson was involved in a motor vehicle accident with my client on September 15, 2016. Did you have access to his physical therapy records from October 2016?
Not to my knowledge.
Let me share screen instead of just reading to you. All right. If he reported on October 10th, 2016, that he was 0 out of 10 on neck pain, is that consistent with having suffered a cervical radiculopathy on September 15th in this accident?
Not sure if I understand the question.
Sure. Well, let me back up a couple questions.
I think we should take a shot every time they say ridiculous.
Do you have an opinion to a reasonable degree of medical certainty as to what caused the cervical radiculopathy that you treated Mr. Jackson for?
I've not been asked to develop an opinion on that.
Did he attribute it to you in his discussions with you? Did he attribute it to you in his discussions with you to the motor vehicle accident with my client?
He did.
And do you have an opinion on that?
Do I have an opinion about whether or not he shared it with me, or do I have an opinion as to this relationship of the car accident with the cervical radiculopathy?
The relationship.
Well, I think it's fair to say I took him at his word.
He did not discuss with you prior chiropractic treatment that he had on his neck?
Let me look back at my notes. He had prior treatment before coming to see me and discussed that he had participated in use of medications, physical therapy, and several epidural steroid injections. My records noted that he had 3 epidural steroid injections, the first of which gave him about 6 weeks of relief, and the second and third not giving him substantial relief. We're only relieving his symptoms for a short time. That's what he related when I saw him on September 7th, 2018.
What he related to you was the treatment he had received since the car accident?
That's just what he related to me, and he related to me that it was my understanding that he had that treatment for cervical radiculopathy, and further, he shared that his symptoms had been present on and off for 2 years and following a motor vehicular accident.
All right, and tell me if I'm saying this wrong. The radiculopathy results from a cervical injury. Is that a correct statement, or is the radiculopathy the injury?
I'm going to hopefully repeat the question so I understand it.
Sure. Is a cervical radiculopathy a symptom of a cervical injury, or is it the injury?
A cervical radiculopathy is a diagnosis.
And is the radiculopathy, my understanding is, a radiculopathy results from a cervical injury and transmits down into the arm. Is that correct? Or is the radiculopathy itself an injury?
A cervical radiculopathy is not considered to be an injury. It's just a diagnosis that is descriptive, as I've shared, of a variety of sensory and what we call motor-based or movement-based concerns. Patients can have an injury that causes or contributes to cervical radiculopathy, and or cervical radiculopathy can also start spontaneously, and so you will see both circumstances.
So cervical radiculopathy can occur even in the absence of trauma?
It can.
Did you have an opinion as to what injury, if any, Mr. Jackson suffered in this car accident, which resulted in a cervical radiculopathy, if any?
I've not been asked to develop an opinion, so I've not shared one.
Okay, so regarding his physical therapy on October 10th, 2016, about a little less than a month after this accident, he went to physical therapy, reported 0 to 10 out of neck pain. 8 days later, reported to physical therapy that there was no pain intensity. On the 25th, he reported minimal to no pain today. And on November 7th, he reported to PT that he was 90 to 95% back to normal. Is that, in your opinion, possible had he suffered this cervical radiculopathy as a result of this accident?
I just want to be clear. Are you asking me to interpret someone else's medical records?
Well, given what Mr. Jackson
That's not what I was thinking.
told them, and taking him at his word, as you did, if he was experiencing no pain in the months following the accident, is that consistent with him having suffered a cervical injury resulting in radiculopathy in the accident?
What I'll say is this. As I've shared, cervical radiculopathy can be waxing and waning, an independent source, and by that I mean independent causation. Whether it might be traumatic cause, a degenerative cause, or a combination of a cause, it's reasonable to assume the patient will have times where pain is better and times where pain is not okay. And all I can share from my own observations with Mr. Jackson is those kinds of things occurred as we attempt to treat Mr. Jackson as well. So again, those are not my medical records, and I'm not going to interpret them for you. But what I will say is waxing and waning symptoms are part of cervical radiculopathy, and it's fair to consider them in the context of the patient, but it's not fair to consider them in isolation.
All right. Let me represent to you then on November 7th, 2016, at physical therapy, he reported that 4 hours after his last session, he was doing some stretches in jiu-jitsu and had a big pop. Do you know anything about that? And do you have an opinion as to what the pop in his neck could have been?
I don't have an opinion. I don't know anything about that.
If Mr. Jackson reported that he had no hand or upper extremity symptoms 2 months after the accident, would you expect radiculopathy to occur 6 months later? Is that a possibility?
Again, what are you asking me to speculate on?
I guess I'm asking you, in your medical experience, if there's no hand or upper extremity symptoms 2 months after the accident, can radiculopathy occur 6 months after and yet still be related to the prior event?
I guess I'd have the same answer that I shared before. It's my expectation that symptoms can be waxing and waning with cervical radiculopathy, and that remains my answer.
Well, I guess more than waxing and waning, is it possible that a radiculopathy could not appear for 6 months after a traumatic event?
Are you asking if it can resolve and then reoccur?
I don't know that there's any evidence that it actually occurred initially. So can it take 6 months to occur, I guess is my question.
Again, a cervical radiculopathy related to an accident doesn't have to be immediately following the accident. However, sometimes it is. Again, I'm only taking Mr. Jackson at his word relative to the things that I've observed. The records that you're sharing with me today are new to me, and to my knowledge, I haven't developed opinions around, nor have I been asked to develop opinion around them, nor have I had a chance to thoroughly review them prior to your questioning me today.
So is there a period of time during which you would expect a radiculopathy to develop if it was in connection with specific causation?
Not necessarily, no.
Do you know when his hand numbness and tingling began?
Again, I can only report my medical records. Again, my first encounter was on September 7th, 2018, and he relates to that his symptoms have been present on and off for about 2 years. So that's what I can share.
Did he share with you that he had not treated between November 2016 and April 2017 in any capacity for these injuries?
Again, I can only share what I have for my records, ma'am.
Do you have anything to that effect about?
My records, I think, speak for themselves. I don't make any comment on that. I can only read you back what I have for my medical records.
Did he lead you to believe that he had been treating continuously since the accident?
He didn't lead me to believe anything. I asked him how long it had been going on, and he stated that his neck pain and his radiating arm pain, which I've described as cervical radiculopathy, these symptoms have been present on and off for 2 years following a motor vehicular accident. That's what he shared.
Your September 28, 2017, well, do you have your records? I'm not certain if this is from your records or not. Do you have 9/28/17 records from his PCP, which indicated that when his neck cracks, he will have tingling down his right arm?
I have my records.
Is that from your record or is that from someone else's record?
I'm just going to review what I have here. I have a visit that I documented on October 5th of 2018. I have a visit that I documented September 21st of 2018. I believe that the records that Could you scroll to the top of that record? That says, quote, Goshen Physicians, New Paris Medical Clinic, unquote. That looks like it's somebody else's office, Ms. Pollock.
Was that shared with you? I know sometimes you share each other's
Give it some
records.
tuna.
Ms. Pollock, I don't know. I don't recall.
Did he complain that his symptoms had, did you see him on February 13, 2018?
I guess I can reiterate that my first visit with him was on September 7th of 2018. So I
Okay,
did not see him in February 2018.
okay. At any time, did you place any restrictions on Mr. Jackson's activities?
Yes,
What restrictions were those?
they would have been post-operative restrictions for 6 weeks, and those would have been for a short time.
I'm sorry, they would have been what?
For a short time, post-operatively, traditionally for 6 weeks, depending on how the patient's doing and progressing with the surgery.
At some point, did you recommend a selective nerve injection for him?
I recommended a C7 selective nerve root injection on 2 separate occasions.
And why did you feel that was the appropriate course of action at that time?
C7 selective nerve root injection in my practice has both diagnostic and therapeutic utility. Diagnostically, it helps us to understand the source of the patient's pain, and therapeutically, it is the hope that it would give sustained pain relief relative to the anti-inflammatory, which is one of the 2 medications injected with a selective nerve root injection.
And he had the first injection on September 21st, 2018, is that correct?
Correct.
I believe those are pages 66 and 69 of your record.
Correct. That is correct.
And did you receive any benefit from the first injection in September of 2018?
He did.
And what kind of relief did he receive?
There were 2 measures of his benefit. The first was the diagnostic benefit that he temporarily achieved with a local anesthetic with short-term pain relief, helping us to understand that it was likely that his pain was coming from C7 radiculopathy and helping us to further understand the source of his radiculopathy in general. And then he did receive some benefit therapeutically as well.
Did he obtain complete relief of his right arm pain?
Again, I'm just going to go back to the records. I wouldn't use the term complete relief, no. On his records on September 21st, 2018, he had substantial improvement. His pre-procedural pain score was 4 on a 10-point scale. His post-procedural pain score was a 0 to 1 on a 10-point scale. He was then seen in my office immediately following the injection and reported that he had relief of his right upper extremity immediately following the injection. In my hands, that suggests that it was diagnostically positive, and I saw him that same day. I should say a team member of mine saw him that same day on September 21st to make that confirmation. He was then seen several weeks after that injection to understand whether or not he demonstrated some therapeutic relief. And it did appear on that date that he had about 60 to 70% relief of his right arm pain, which appeared to be satisfactory. He reported that he was pleased with how he was doing. He didn't have any new symptoms and he was hopeful. So we scheduled a follow-up visit 6 to 8 weeks out from that appointment. He was then seen and evaluated once again on November 2nd of 2018. That was in follow-up for the same injection, and he noted that his pain relief was good with respect to his right upper extremity. He did occasionally have some intermittent symptoms, but he was generally pleased with how he was doing, and he noted that he was also taking some gabapentin as well, which is a nerve pain medication.
So to be strongly diagnostically positive, what does that mean?
To be strongly diagnostically positive, there needs to be a substantial relief of the pre-injection type of pain that a patient is having. It's not specific to a structure, it's specific to pain relief, which is a reflection of, in this case, the local anesthetic, which is injected. For example, if a person had an intra-articular hip injection, had significant pain to whatever degree prior to the injection, that's relieved after the injection, we would say that that's strongly diagnostically positive. And then we would relate it to the structure that was injected. In Mr. Jackson's case, the structure injected was the right C7 nerve.
You next saw him on October 5th, 2018, is that correct? I believe that's page 62 of your records.
Correct.
At that point, you reported 60 to 70% relief of his right arm pain as of that date?
Correct.
He had no new symptoms to report?
That's what he stated.
He indicated he was hopeful that his pain relief will continue over time. Is that something that continues to progress?
Could you repeat the question?
Yeah. According to your records, he was hopeful that his pain relief will continue over time. So is that type of injection something that's progressive and will continue to work for some time?
It's variable. He just expressed hope that he would have continued relief. Are you asking me if that's misplaced hope?
No, I guess I'm asking you, so obviously he found immediate relief. And then it's also something that I guess I'm just asking you, Is that something that will continue to provide further relief as it, I don't know, permeates? I don't know. Is that something that will continue even if he received immediate relief? It will continue to work as time goes on?
I want to try to repeat the question and answer. The statement the patient shared was that he was hopeful that his pain relief would continue over time. And that statement is a reflection of what he shared. It's not a reflection of what may or may not happen, but that's what he shared, and so I wrote it down in the note. Relative to whether or not that will happen, that is the point of further follow-up.
In your experience, doctor, when someone receives relief from the selective nerve injection, how long does it take for the full relief to take effect?
It's variable, but most patients get some modicum of relief within the first week or two, which is why we saw him 2 weeks after the injection. But it's understandable that cortisone injections do have a bit of a delayed effect. So relative to the pain relief that he experienced on the day of his injection, anything that he may or may not have experienced was largely attributable to the local anesthetic. Therefore, the point of the 2 and approximately 6-week follow-up thereafter was to assess the therapeutic benefit. Again, I'm not trying to predict the future. I'm just trying to document how he does, because that's important for me as his treating provider to understand next steps for him.
Did you consider the results you observed and that you reported on the 10/5/18 visit to be a good result?
I took him at his word. He was pleased, and therefore I was.
When was he next seen?
November 2nd, 2018.
What was the purpose of that visit?
A follow-up 6 weeks after the prior.
Who saw him on that day?
He was seen by Jacqueline Demeter, a physician assistant in our practice.
What were her findings?
Her conclusion in her assessment was that the patient was doing well 6 weeks after his right C7 selective nerve root injection related to concerns of a right-sided disc herniation at C6-7. She also concluded that he was taking gabapentin twice a week at nighttime.
Did she note that he was very pleased with his progress to date?
The statement that the patient provided to her at that time was that overall he was very pleased with his progress to date.
And she indicated that he continued to have good relief of his right arm pain?
She stated that the patient continues to have good relief of his right arm pain.
At that time, she discussed non-surgical care over time, such as a repeat of the selective nerve injection.
It appears that ongoing or more regular use of gabapentin was discussed at that time. The side effects of that same medication were discussed. Additionally, non-surgical care was discussed, potentially including the possibility of a right C7 selective nerve root injection. It appears that a discussion of surgical options was also undertaken regarding the C6-C7 anterior cervical discectomy infusion, which was elective and would represent a non-surgical care failure.
How many selective root injections will you try before you'll move on to a surgical option?
It's variable.
And Mr. Jackson underwent 2?
I believe that's correct, yes.
So by the time a patient chooses surgical intervention, that represents a failure of non-surgical care?
I think it's fair to say that in this surgical intervention, surgery is elective.
Do you feel that non-surgical care did fail in Mr. Jackson's case or not?
That's Mr. Jackson's opinion.
Is it standard to discuss with the patient surgical options, even if they are doing well with non-surgical options at the time?
Of course.
So surgery is always presented as an option to the patient?
I think we always try to present a spectrum of care, and although we are surgeons and our surgical team, our goal is non-surgical treatment over time. Patients will appropriately ask us what the spectrum of care is, and we try to provide reasonable options consistent with those standards of care. So it is, yes, very appropriate to discuss the possibility of surgery with patients, and patients will often bring that up when they see a surgeon for the first time. Whether or not we ever intend to go down that path is, again, up to the patient.
When did you next see Mr. Jackson?
November 30th, 2018.
What did he report to you at that time?
Neck pain radiating into his right upper extremity with numbness and tingling.
Was his last visit the visit that we had just discussed then with the PA?
Correct.
Did he report to you that he had a recurrence of his symptoms with some recent jujitsu exercise?
Correct.
Prior to that, he'd been doing very well?
That's what he stated, yes. Well, I should say that his last visit, he stated that he was doing well, and then he shared that with some recent jiu-jitsu exercises, he had a recurrence of his symptoms.
Did he indicate at that time that he would like to consider a repeat selective nerve root injection on the right?
That was part of our discussion, yes.
Did you endorse that plan of action?
It seemed to be reasonable, yes. He had good benefit from his former injection. He was hoping to continue to pursue non-operative care, which is appropriate. That is the same injection which had given him good relief before, and so I agreed that it was appropriate to consider.
In light of the fact that he indicated he had been doing better until jiu-jitsu caused him to have a recurrence, did you have any discussion with him about whether he should continue to do jiu-jitsu?
No.
Did you have an opinion as to whether he should be engaging in jujitsu during this time?
I did not express an opinion. I don't have one.
If he had not experienced this recurrence of symptoms following jujitsu, would you have expected him to continue to improve?
That's unknown.
Would you have expected him to likely need additional injections had he not re-injured himself?
Unknown.
Would you have expected him to ultimately need surgery?
It's unknown.
When did he receive his second injection?
December 21st of 2018.
Who performed that procedure?
Dr. Robert Funk.
Why did Dr. Funk do it rather than you?
Dr. Funk is an anesthesiologist in my practice. I do not routinely perform injections in my practice of this type. Dr. Funk is the same physician and anesthesia pain management specialist, board certified in pain procedures, including injections, who performed the first injection.
What kind of relief did Mr. Jackson get from the second injection,
Baby.
if any?
On the date of his procedure, he once again reported a pre-procedural pain score of 4 on a 10-point scale and a post-procedural pain score of 0 on a 10-point scale. Therefore, 100% relief at the time of his injection performance of his radicular pain.
Now, following the first injection, he had a 2-week and a 6-week follow-up. Is that correct?
He had more than that. He had a 2-week follow-up and a 6-week follow-up, and then he had a follow-up on November 30, 2018 with his reoccurrence. So he had multiple follow-ups, if that's what you were asking.
In Lancaster, where I live, there are tons of Smuckers and Funks. You can't even walk down the street without hitting some of them.
I followed him for quite some time.
So following this injection, it looks to me like he was not seen again until July the 19th, 2019. Is that correct?
I saw him on that day, or should I say, I'm sorry, Jacqueline Demeter saw him on that day. So a member of our care team saw him and affirmed that his injection was diagnostically positive. Again, that was on the same date of the performance of the injection. His next follow-up visit in our office was July 22nd of 2019.
All right, so I guess my question is this. Following the second injection, why did he not need the same level of follow-up care that he did after the first?
I don't know.
Is one more common than the other? Do you generally see a patient several times in the ensuing weeks after an injection?
Well, what I'll say is that obviously he had injections that were diagnostically positive twice. So we had a good diagnostic data set from Mr. Jackson, really knowing that he had had therapeutic relief for up to and including 6 to 8 weeks after his first. At that point, it was fair to assess, how that would work. So he doesn't necessarily require those 2 and 6 week follow-ups. Not suggesting that it would be inappropriate to do that, because sometimes we do that as well. Mr. Jackson lives some miles away from our office. All I can tell you is he didn't follow up until July 19, 2019.
Do you know from your records whether he was advised to follow up sooner than that following the second injection?
I need to clarify something. I did misspeak. I do not think that he was evaluated on the day of his injection, his second injection. Specifically, he had an injection, his second injection was on December 21st of 2018. And we saw him on November 30th ordering that injection for him. On that date, we advised that we would like to see him 3 to 4 weeks after that injection. So it was on a date prior to the date of his injection where we had asked him to return to CS in 3 to 4 weeks. My former statement that he was seen on the same day by a member of our team was incorrect.
Okay. And then the fact that he was not seen for 7 months following his second injection, is that unusual in your practice?
That's just what happened.
Is that normally the protocol following an injection?
Again, our advice to him was to follow up in 3 to 4 weeks. So that was the advice that was given to him. He followed up later than that.
Directing your attention to page 49 of your records.
I'm there.
Okay. Do you see that Mr. Jackson saw Ms. Demeter on that date?
PA Demeter, correct.
Okay, and did he indicate that he was focusing on decreasing his alcohol consumption?
The patient stated that, correct.
And is alcohol consumption something that could affect the patient's rate of recovery or extent of recovery?
That's unknown. He just shared that he was focused on decreasing his alcohol consumption, which I would say is medically appropriate in any circumstance.
Did you have any understanding of the extent of his alcohol consumption?
Nothing than what he shared.
And he also shared at that time with PA Demeter that he was continuing to participate in jujitsu. Was that for any reason contraindicated?
We've stated before, and I've stated before, that he had no contraindications to participation in anything, including jiu-jitsu. And specifically, he had no restrictions from our practice during that time or prior to his surgical intervention.
How can excessive alcohol consumption affect a patient's ability to recover from an injection such as this?
From injections?
Yes.
Well, I guess I'd what I've stated is alcohol consumption is not something which is not something which is good for your health in general. Alcohol consumption and selective nerve root injections are not necessarily closely linked with relationship to therapeutic outcome. I suppose I could look that up, but I'm not aware of existing studies which would suggest that alcohol favorably or unfavorably affects outcome as an individual factor. Again, our records only share what the patient stated or only know what the patient stated.
And did PA Demeter ever indicate that he should not consume excessive amounts of alcohol?
I'm reading directly from her note, and in subjective or history of present illness, the patient stated that.
Did excessive alcohol interact poorly with any of the medications he was taking?
The biggest concern would be those that are processed by the liver, including medications such as Tylenol, and the patient had historically taken tramadol in the past. That would be a concern. Narcotic medications are processed heavily by the liver. In contrast, gabapentin is processed by both the liver and the kidneys.
It's okay, Fozzie. I deleted Donald's comment. Bad Donald. How dare you?
Non-steroidal anti-inflammatory medications are processed by the liver and the kidneys. I've stated that alcohol is not a good thing in general and is not medically recommended in general. I've also stated that the patient reported that in his subjective interactions with us. I have also stated that the patient reported that in his subjective interactions with us, and so we documented it.
Did continued excessive amounts of physical activity in any way hinder his ability to heal?
Could you restate the question?
Sure. Did the fact that he engaged in excessive physical activity, such as jiu-jitsu, hinder his ability to heal from these injections?
Not to my knowledge. I will restate, the patient has not been, was not at that time under any restrictions in our practice. In contrast, the intention of any of the non-surgical or surgical interventions that we might do for a patient is exactly with the intention of getting the patient back to whatever they were doing, including but not limited to jiu-jitsu.
At some point, surgery was scheduled, doctor, is that correct?
The patient underwent surgery.
When did he elect surgery?
The patient had a pre-procedural evaluation on July 31st, 2019 to discuss the procedure which had previously been discussed with him. A C6-7 anterior cervical discectomy infusion related to a C7 radiculopathy. Additionally, the patient was also seen on July 19 of 2019, noting ongoing pain and cervical radiculopathy. At that time, he also felt strongly about proceeding with surgery. We discussed the surgery, C6, C7, anterior cervical discectomy infusion. We discussed the perioperative course and the intervention, and he wanted to proceed with the scheduled process, which included the preoperative visit, the date of which I just mentioned. In addition to that, we wanted to look at a new MRI, and the patient underwent a CT scan as well.
All right. I'm a little confused about the timing here. So he underwent his second injection in December of 18, and then you didn't see him again until July of 19, and that's when he said he wanted surgery?
His next visit was on July 19, 2019. At that time, he noted he had some relief from his right C7 selective nerve root injection however, he was continuing to have pain in his arm and neck. At that time, he mentioned, and we discussed cervical discectomy infusion. So the first discussion was on July 19, 2019, and then a second discussion was for his pre-surgical evaluation also occurred in July, as documented on July 31st, 2019.
If he had come back for the regular follow-ups following the second selective nerve root injection as recommended, would you likely have encouraged him to consider additional root injections rather than surgery?
It's hard to speculate. I don't know what I would have done because I didn't see him.
Is there a limit to how many injections you'll try before you feel like you need to move on to surgical options?
Yes, no, and kind of. And I'm sorry to be vague about that. I mean, if injections aren't providing the patient with good therapeutic relief, there wouldn't necessarily be a point in repeating injections for therapeutic process or purposes. But it's also fair to say, in some circumstances, patients will get a period of relief with 1 or 2 injections, or their first injection will do well and the second injection will fail. And then, relative to that, there's also something to be said for frequency. So although there isn't a hard and fast rule, we can't be doing injections every week or every month. So typically, if patients are getting months of relief, a repeat injection could be considered as a reasonable non-surgical treatment. On the other hand, if they're only getting a few weeks or days of relief, most typically, repeat injections wouldn't necessarily be an appropriate non-operative choice. It's worth a discussion, but if it's not it's worth a discussion, but if it's not working well, we wouldn't necessarily recommend that somehow a third injection, for example, would do better than a failed second injection in a hypothetical circumstance.
What's the maximum frequency with which a patient can undergo a selective nerve root injection?
I would share that there isn't necessarily a maximum frequency, but in our practice, we evaluate the patient or attempt to evaluate the patient for each and every one of their individual injections. So as I've stated, if an injection works really well, hopefully relief measured in a month or more, then it might be reasonable if the pain returns to repeat an injection. If an individual injection, if technically successfully performed, doesn't give good relief, it wouldn't necessarily be reasonable to keep trying those injections. For example, the patient had a series of epidural injections prior to seeing me by history, noting that the first injection worked and the second two did not. Therefore, we recommended an alternative injection, which had not only a therapeutic potential benefit, but a diagnostic benefit, which is not traditionally associated with epidural injections. We didn't, for example, recommend a fourth epidural injection because his prior two injections by history had not worked.
But Mr. Jackson's 2 prior injections had worked by his report?
No, what I said by history, he had 3 cervical epidural steroid injections. He noted that the first one gave relief, but the second 2 did not give substantial relief. And I believe that was documented in my first interaction with Mr. Jackson.
So at the time it was determined that you would proceed with surgery, what symptoms was it hoped that the surgery would alleviate?
The surgery was intended to address the patient's foraminal stenosis at C6-7 with the hope that the patient might have an opportunity to experience improvements in his right-sided cervical radiculopathy.
And these are the symptoms that he reported to you. Had you done 2 years before you first saw him, or were they?
I believe those were his words in my first little note or something to that effect. I can go back and read them if need be.
So these were not new symptoms which developed, these were symptoms that he originally complained to you about?
The patient continued to routinely complain of right-sided cervical radiculopathy and a C7 distribution, which was confirmed with multiple diagnostic modalities in my office and at the discretion of my teammates.
Doctor, what can cause nerve pain?
Nerve pain can come from an inflammation around a nerve, compression of the nerve, but it can also come from intrinsic concerns within the nerve, which could be metabolic, viral, or something related potentially to medications or external treatments. Radiation therapy can cause nerve dysfunction. Chemotherapies, of which drugs are included, can cause nerve dysfunction. Infections can cause nerve dysfunction, including viral concerns or infections adjacent to a nerve. One common cause of neuropathy, again, would be a metabolic disease such as diabetes. So there are a variety of things that can cause nerve dysfunction.
Did Mr. Jackson have a history of nerve pain?
Mr. Jackson had a 2-year history of right-sided cervical radiculopathy and neck pain he related when he came to visit me.
And he did not share with you whether his neck pain went back beyond that date?
He did not. He related to a motor vehicular accident that occurred, it was my understanding, approximately 2 years prior.
On July 31st, 2019, PA Demeter evaluated Mr. Jackson prior to his surgery?
Correct.
Okay, she noted on the MRI, multi-level osseous foraminal narrowing, right worse than left, on the background of multi-level fusion anomalies. Can you explain to me what that means?
I'm going there. Could you please share the page that you're looking?
Page 44.
Thank you. Page 44 is a report of an MRI of the cervical spine, and that interpretation is actually from the radiologist. And Dr. Brian Jellison is the radiologist that interpreted Mr. Jackson's MRI on the date of its performance.
Okay.
I'm not suggesting that that's not correct, but I'm just clarifying the record that it was Dr. Jellison, a neuroradiologist from Northwest Radiology, that stated those things rather than PA Demeter.
All right. And then is that the same radiologist, the one who would have interpreted the CAT scan of the cervical spine on page 47 of your records? Noting, quote, multi-level osseous foraminal narrowing on the background of multi-level fusion anomalies, unquote?
Dr. Jellison interpreted the CT scan also performed on January 31st, 2019.
Okay. And tell me, were those findings and impressions noted by Dr. Jellison relevant to the purpose of the surgery?
Yes.
Why is that?
Relative to Mr. Jackson's concern of the C7 radiculopathy, it was our diagnosis going into surgery that the disc osteophyte concern at C6-7 was contributing to foraminal stenosis of his right C7 nerve root, and in turn contributing to his C7 radiculopathy. And while these images don't necessarily prove causation, Mr. Jackson's workup did help to correlate the findings of these images with Mr. Jackson's concern. And specifically, that included findings that he described of the C7 radiculopathy, his 2 diagnostically positive C7 selective nerve root injections, and his physical examination findings, including his right-sided tricep weakness, with the tricep being predominantly innervated by the C7 nerve root.
So the findings or the impressions from the radiologist are of congenital conditions, correct?
That is incorrect.
That's incorrect.
The findings demonstrate both congenital concerns at C2-3 and T1-2, but also demonstrate congenital degenerative concerns in the intervening segments, both above T1-2 and below C2-3.
So of the findings from the MRI and the CAT, are any of these findings which would be consistent with an acute injury?
What's your definition of acute?
A traumatic injury.
None of these are necessarily indicative of a traumatic injury, yes or no. They are indicative of the findings demonstrated at the time.
So I guess my question, did Mr. Jackson have congenital or degenerative conditions which contributed to the need for his surgery?
Mr. Jackson had a concern at C6-7, which included disc osteophyte complex and foraminal stenosis. And it's our belief that that contributed to the C7 radiculopathy, which in turn led to his choice to move forward with surgery electively.
So the stenosis that you talk about, how does one get that?
Stenosis C6-7 comes from conditions including but not limited to degenerative disc disease, facet arthropathy. And again, these are wear and tear phenomenon related to discs and joints. There are several joints that are considered to be present in the cervical spine, one of which is a true synovial joint, the facets of C6-7. The other is referred to as an unconvertible joint, which is effectively the postal lateral aspect of the disc space. The unconvertible joint, or joint of Luschka, is something that can hypertrophy and have, or if you will, commonly referred to as bone spurs, develop behind the disc space. And as those things occur or are confounded by wear and tear of the disc concerns.
I have no idea what this guy just said, but I understood bone spurs. So why couldn't he just lead with that?
Which can be both degenerative and acute patients can have worsening of stenosis. That is not necessarily meant to attribute the presence or absence of symptoms. It's an imaging finding. So Dr. Jellison, who is a neuroradiologist, is reporting imaging findings at multiple levels, not only limited to C6-7, but also including other motion segments in Mr. Jackson's spine.
Did the surgery address all of these conditions noted by Dr. Jellison?
Certainly did not. It was only intended to address the concerns at C6-7.
When did you perform the surgery on Mr. Jackson? I believe that's page 35.
I performed the surgery on August 5th of 2019.
Can you explain to me exactly what the procedure was that you performed?
The procedure is referred to as a C6, C7 anterior cervical discectomy infusion. It's performed with an allograft bone, commonly referred to as a donor bone, and a cervical plate placed on the anterior vertebral bodies. The surgery is performed through an incision in the front portion of the soft tissues of the neck. We dissect, moving some of those soft tissues out of the way, down to the anterior or ventral aspect of the cervical spine. We identify the disc at C6-7, remove the disc at C6-7. We dissect back behind the disc into the area where there is foraminal stenosis. We assess the foraminal stenosis relative to the C7 nerve root. We address the bone spurs and large pipe by removing them with microsurgical tools, opening up the space directly around the C7 nerve root. We do that on the contralateral side as well, treating both concerns despite the fact that the symptoms are traditionally unilateral. Again, because we're removing the entire disc space and not just the right or left side of the disc space, we then reconstruct the segment by putting a small wedge-shaped piece of allograft bone, again commonly referred to as donor bone, into the former disc space. This is intended long-term to create a fusion across the two vertebral bodies, C6 and C7. We then place an internal plate, which is meant to be an internal stabilizer of that fusion. That plate spans the disc space and is attached to the vertebral bodies of C6 and C7, which with screws.
I'm sorry, but all right. I'm stupid. I didn't do any doctoring at all. But if you're taking a disc out and you're putting bone in there so that it fuses together, he won't be able to bend his neck anymore. He won't be able to say yes. He'll probably be able to say no, but he won't be able to just say yes. Is that right? Is that what happens? No wonder no one wants to get back surgery. Who the hell wants that to happen? That's terrible. What happens? Like, can you break it? Can you try to say yes one day and just break it? This is terrible. Guys, don't get back surgery.
That plate and screw fixation device is also effectively an internal brace. We then close the incision and conclude the surgery.
Was there anything about Mr. Jackson's congenital condition that rendered this surgery more difficult?
No,
Did the surgery help Mr. Jackson's symptoms?
it appeared to.
You indicated that you placed him on some post-operative restrictions for about 6 weeks.
Correct.
What were those restrictions?
Those restrictions included a lifting restriction of 10 pounds for 6 weeks. Activity with mobility of the neck is tolerated because of the internal plate that is placed. He does not require a collar or rigid cervical orthosis. For example, we do counsel patients to not drive while taking narcotics. We do ask the patient to be mobile as possible early on in the home setting to minimize concerns from immobility, such as deep vein thrombosis. Those are some of the things, the records that are included in today's deposition are not a reflection of all the counseling perioperatively, but those would be typical of some of the things that we give to a patient in our perioperative packet. And that perioperative discussion, again, occurs on the day of the patient's preoperative evaluation. But the patient also has a continued discussion before he leaves, in this case, the surgery center, and goes home, and further has access to our team thereafter to reinforce those things.
Do you know whether he complied with his restrictions?
He appeared to.
Is there anything in the records at your practice which indicate that when he returned following his second injection, when he returned in July, did he indicate to anybody that he'd been involved in an accident with a deer in February of that year?
I'm scrolling to that page now. If you have it in front of you, that would.
Honestly, I don't know. I don't see that he did tell you that, so I honestly don't know that you have it.
Sorry, there's a lot of, I'm scrolling back to the visit in question here.
Rather than have you search for a negative, let me rephrase. If Mr. Jackson had been involved with an accident in an accident with a deer in February of 2019, could that have affected his symptoms and his injury or his condition?
It's unknown. I'm now looking at the document.
I'm gonna have nightmares now. This turned into a whole nightmare. Listen, there's a fun part coming. I didn't know we would have to get through this terribleness.
Dated July 19, 2019. In that document, I do not see anything related to an accident or a deer.
And you say it's unknown whether that could have exacerbated things?
I haven't developed an opinion around that, if that's what you're asking. And prior to today's date, again, I don't know. I don't have any documentation or record of an accident that would have occurred involving a deer in February of 2019.
Directing your attention to page 32, I believe that was his first post-operative following his surgery. Is that correct? 8/21 of 19.
Mr. Jackson returned on August 21st of 2019 for his first
Long story short.
post-operative visit.
But seriously, guys, he has a nice tie on. Did you notice his tie? It's lovely.
2 weeks, the 2-week follow-up approximately after his C6-7 ACDF.
And was that with you or was that with PA Divier?
This was with both me and my fellow. My fellow at the time was Dr. Daniel Leese, MD, who at that time was a fellow in training, and I would have seen the patient in conjunction with that visit. So there were 2 MDs involved, but that was primarily at my discretion. So if you look at the note, you'll see that it was initially documented by Dr. Daniel Leese, and thereafter documented by me in this circumstance, as he was in training and would have both, and as he was in training, we would have both seen him that day.
He reported overall he was doing extremely well.
He stated that he had about a 90% reduction at that time in his arm symptoms, some very mild neck pain with extremes of motion, no issues with swelling or phonation, and that his activity around the house were not causing him any concern. He also noted that he was not requiring any pain medication as of the date of our visit.
In fact, he indicated he had been very active around the house, didn't he?
He stated that he had been very active around the house, which is part of our recommendation. We do ask patients to be mobile during the day, moving about, again, with the intention of diminishing the risk of immobility concerns such as DVT, pneumonia, or atelectasis from our anesthesia and such.
And the statement, quote, overall, he is doing extremely well, unquote, would that have been his statement to you, or would that have been your perception?
It's a combination of things. He shared that he was doing extremely well and that he had a 90% reduction in symptoms. We documented that, but I would state that I don't disagree. Having that result at 2 weeks would be considered a favorable outcome.
And he was due to return to work the following Monday with continued restrictions. That's on page 33.
Correct. That's correct.
Yeah, because doctors don't give them out like candy anymore. I want candy.
Okay, and when he asked about resuming jujitsu, you asked him to hold off until the 6-week mark, and the same with lifting restrictions.
We did.
Do you know if he did that?
I don't know.
All right, and then PA Demeter saw him again on 10/23/19, page 27.
Correct.
And what occurred during that visit?
It is documented that the patient noted that he was doing very well. He described at the time complete relief of the symptoms in his upper extremities. He described some very mild neck pain with, once again, extremes of extension. He described some mild problems swallowing and some mucus or phlegm that was occurring with coughing activities, and that these things were infrequent. He noted that he was very physically active, including participation in jiu-jitsu and physical therapy, as well as success in returning to work.
Now, when a patient complains of a mild neck pain 2 months post-op, do you attribute that to just some lingering pain that you're never going to get rid of, or is that still from the surgery?
It could be both. It's hard to know, truthfully. Certainly, even beyond 2 months post-operatively, there can be some ongoing pain that's related to surgery.
What do you mean by the strict rule? Like, okay, so most patients don't adhere to the strict rule. Is the strict rule like you're not allowed to bend over to pick up something that dropped, or things like that? Because what happens if you do? Kelly, what happens if you bend over? Can you break it, or is it just impossible? Like you just cannot bend. I hear you guys saying it limits your mobility, but what happens if you do bend it? I need to know. And what is the strict rules now?
If fusion doesn't traditionally heal on the inside of the spine for 1 to 2 years in the best of circumstances, and despite the fact that there is a plate and bone graft there is some micromotion through the area. So in certain circumstances that can cause neck pain, but neck pain is also multifactorial. So, there could be neck pain coming from other concerns that are not related to C6-7. So we kind of exclude those things. I think the only thing that we can say is that the fact that he was satisfied with how he was doing suggested that the surgery provided him with benefit. With respect to his relief of his cervical radiculopathy, improved his neck pain in a way that appeared to be meaningful to him.
You said neck pain can be multifactorial. What other things could cause neck pain?
Well, as mentioned, surgery and recovery from surgery. A failure to completely recover from surgery could cause ongoing neck pain. So in those circumstances, we would continue to attribute to C6-7. But as previously noted, he has other areas of degenerative disc disease,
My head is in the way.
areas of spondylosis, which is a fancy medical term for degenerative disc disease and arthritis. So it's possible that what he had left over is something that is residual from other concerns in his neck as well.
Okay, page 24. It looks like you next saw him on 2/29/20.
I'm sorry, 2/19/20. Yes, February 19th.
Yeah, and at that point, his arm pain was gone and his neck pain was gone.
This was a 6-month post-operative visit. He noted that overall his arm pain was gone and his neck pain was gone.
And again, the patient's doing very well. Is that your perception or is that his statement?
His statement was that he was back to his activities without restriction. He said that he was pleased with his outcome. In addition to sharing that his neck pain and arm pain was gone, that certainly was my perception as well. But that's what he stated.
Well, I assume that first sentence is your perception because you're calling him a pleasant 40-year-old male who's generally doing very well.
That's my statement, correct?
Okay.
And then he further stated that his arm pain was gone and he was back to his activities and he was pleased with his post-operative outcome.
Okay.
So he shared the same.
All right. And he was told to follow up in 6 months?
Yes, we asked him to return approximately 6 months for his we asked him to return approximately 6 months for his 1-year post-operative follow-up visit.
Okay. Instead, it looks like he returned in just a few months on May 27, 2020, page 21 of your records, and saw PA Demeter. Can you tell me what that was about?
The patient returned on May 27 of 2020. Scroll down to the bottom of the note. He was indeed seen by PA Demeter at the time of the visit. He noted that he had an abrupt onset of paraspinal pain in his neck and left upper extremity pain after participating in jiu-jitsu. He noted that his head and neck were pressed into the ground, and that he felt a tearing sensation in his right paracervical region. Following that, he noted that he had the onset of paresthesia in his left upper extremity, including his left fifth digit small finger. He noted that since the time of his symptom, though, had resolved. He noted that he did continue to have some mild discomfort in his right paracervical region, but overall he was not having some new symptoms to report. He noted that he was not utilizing any medication by mouth at that time.
Do you have an opinion based on his description of the head and neck being pressed into the ground and the tearing sensation and the onset of paresthesia? Do you have any opinion as to what might have happened?
I mean, no respect by this, but it sounds like his head and his neck were pressed into the ground.
The tearing, do you have an idea what might have happened there?
Oh, I'm sorry. I see what you're saying. What would have caused that sensation?
The tearing sensation resulting in an onset of paresthesia?
I see. Not necessarily. I'm only in that case, I'm reading what PA Demeter wrote as a result of what he reported. I don't think there's a conclusion that is drawn under what is largely a subjective description of what occurred and the symptoms he felt at the time. He also noted a resolution on that date. However, objective assessments were performed, including radiographs of his neck. Those did demonstrate his posterior and his prior anterior cervical procedure, C6-7. The bone graft material was within the disc space of C6-7. And his former congenital anomalies were, of course, still present at 2-3 and T1-2. And relative to that objective assessment, as well as his report of improvement, those were found to be reassuring findings.
All right. He then saw PA Demeter again on 9/9/20, page 18.
Correct, September 9, 2020.
Why was he there on that date? Because that's still ahead of his schedule.
That would have been roughly his 1 year post-operative visit. It's 13 months out from surgery.
Okay.
So I don't know if that would have been the one that was previously scheduled or whether or not he scheduled it. I mean, although you do attempt to see patients roughly post-operatively at 2 weeks, 6 weeks, 3 months, 6 months, 12 months, and 24 months, certainly there's some flexibility. So I can't tell you if he scheduled that a little bit afterwards, but that certainly was intended to be, or appears to have intended to be, his 1 year post-operative assessment.
And he was doing quite well. Again, is that PA Demeter's opinion or is that his, if you know?
I don't know whose opinion that is. I assume it may be PA Demeter's opinion. He reported no neck pain or arm pain. He reported at his last visit for concerns of a popping sensation in his neck, and that since that time, the resolution of the aching in his neck had resolution of the aching in his neck, forgive me. And then he reported that he was pleased. So it appears that PA Demeter was pleased with his progress, and the patient himself, in his words, very pleased with his progress.
And it looks like the radiographs were quite reassuring in demonstrating appropriate fusion healing at this point, page 19. Would that be Dr. Jellison's interpretation?
No, those radiographs are interpreted and are in office either by PA Demeter or in the case where I'm seeing him by me. And I'm sorry, what I should say to fully answer your question is that there was progression of ossification of the allograft within the disc space, which then should be interpreted to be appropriate healing.
Which means the fusion was fusing?
Yes, under the plan heading plan, or under the heading plan. So basically, when you look at the radiographs, that's a visual assessment. In that circumstance, the description is of the ossification or the calcification of the bone. But then under the plan, the interpretation is that the patient's radiographs are reassuring and demonstrate appropriate fusion healing at the 12-month post-operative time point. I believe there's a typo there, but that's intended to be the 12-month post-operative time point.
Let me direct your attention to page 14 of your records, which is a 2021 visit during which you saw him, I believe.
Yes, I'm there.
All right, that was September 8th, 2021.
That is correct.
And is it typical to do a 2-year post-op evaluation?
In my practice, it is, yes.
And what did you note on that date?
Again, the patient was approximately 2 years after his surgery. The patient himself denied neck pain or upper extremity pain. The patient reported that he was back to working at 2 gyms and teaching and also practicing jiu-jitsu. He noted that he was doing well. He noted that he was not having new symptoms to report and that he was personally pleased with his post-operative progress. He mentioned concerns about the insurance concerns, which were described as complications with respect to his intervention. I presume that was his surgical intervention and his spine care, and he shared those at that time.
And did he share with you that he was back to work at 2 different gyms teaching and practicing jujitsu?
Correct. That's essentially what the note says. Yes. Those were my words that I placed in the note. Yes.
You indicated he was doing quite well.
Yes.
So did he tell you that he was pleased with his relief from his radiculopathy and generally speaking was highly functional, or are those your words? And I guess that's on page 15 under assessment.
That is my assessment, that he was pleased with his relief and was highly functional. So those are my words,
Okay,
which my words belong in the assessment.
all right. Under plan, you said that, quote, he has continued neck pain from time to time. He does have degenerative disc disease at other levels, unquote, but your treatment focused on his disc herniation and radiculopathy at C6, C7, and from his treatment, he has recovered well. So are you saying that there are still conditions in his neck that may cause him problems going forward?
I mean, I guess we had an overall discussion about the conditions of his neck at the 2-year visit, which is typically where patients would conclude their elective or scheduled time with us. We do discuss any ongoing symptoms that they might have. We certainly can't predict the future, but we discuss, the concern for which he was treated. And again, loop back into some of the conditions that were present in addition to that, which to date haven't been highly symptomatic, but could be. That doesn't mean that they will be. And later in that discussion, he inquired about the differences between some of his congenital concerns, including his failure of segmentation, and his more acute concern for which we treated him at C6-7.
So from a medical perspective, then, Mr. Jackson's concern at C6, C7 was an acute concern, which was not directly related to his baseline congenital diagnosis, is that correct?
That's generally my medical opinion, yes.
Although his congenital diagnosis did make planning for surgery a little bit more challenging?
It did not make it more planning. It did not make it more challenging for me, and I've already stated that.
So you disagree with the records then on page 15, 16 that state that?
I shared earlier that it didn't make my surgery more challenging. I don't disagree with that statement, but
Okay.
relative to my comment there, he was referred by Dr. Caldwell, and it was my impression that he was referred or told by that surgeon it would be more challenging.
But did the cat get you? That's what I want to know. Listen, Kay, when you're camping with your children and there's a wild animal, it's all meant for themselves. Throw one of your kids outside, the rest of you'll be fine.
For him, and therefore, in the overall context of things, he had to transfer his care when he was referred for me. And so, what I say is planning for surgery. It was the patient's impression, and he shared with me verbally. Then having to transfer his care down to me, it made things a little more challenging. So I guess how I would clarify that is it didn't affect my ability to do the surgery, my personal planning for surgery. It didn't make it any more complicated for me. It certainly affected his ability to access care. I don't think it was a huge delay in care, for example, but I think the planning part for him was hard because he had to switch providers.
Have you seen Mr. Jackson since that visit, that 2-year post-op visit?
I don't believe that I have.
And I think you've answered this, but I just want to be sure I have a clear understanding of your answer. Do you have an opinion as to whether the September 15, 2016 motor vehicle accident was the reason Mr. Jackson required the surgery that you performed?
I took him at his word that that's why he sought care historically and with me. I had no reason not to believe Mr. Jackson with respect to what he shared with me. And he certainly didn't share anything more than about that or anything less about that. And that's what he shared. And then we went down the path of treatment of his concern as well as his diagnosis and workup.
If he had shared with you that he had prior complaints of neck and shoulder pain and chiropractic care, would that have changed your opinion regarding taking him at his word?
No.
Could his congenital conditions alone eventually require surgery?
Not typically, no. There's a phenomenon, however, referred to as adjacent segment degeneration or adjacent segment change. There are a variety of terms that are used within the medical literature. Traditionally, those are applied to a person who has had a fusion but has not had a congenital concern. What can happen, we believe, in a person that has had a fusion is that a disc or bone or joint adjacent to that can eventually have radiographic change, which is a visual finding. And some patients can go on to symptomatic findings related to that radiographic change. We then call the symptomatic finding adjacent segment disease. There's a concern that I think is fair to describe in congenital concerns where a disc adjacent to a congenital failure segmentation, or if you will, an autofusion, may have more rapid advancement of degenerative disc disease or spondylosis.
I got bored and phased out, guys. I'm gonna have to rewind it a bit. Start over.
In this case, obviously we treat a disc that is 2 levels above his failure of segmentation at T1-2. The level that would be immediately adjacent to that and the cervical spine is C7-T1. He certainly did have degenerative disc at C7-T1, but his symptomatic level was C6-C7. All I'm hoping to share in my rather voluminous answer to your question is that we speculate in my world that a congenital failure of segmentation could potentially hasten the wear and tear of an adjacent segment. Again, in this case, C1-2 potentially could be C2-3, for example, or in the case of his also failure segmentation at T1-2, and that could be at C7-T1. It doesn't mean that they're going to have symptoms from it, but it's a concern.
Do you have access to the radiographic testing that was done on the date of the motor vehicle accident at the hospital?
May I review my records radiographically?
Sure.
I'm not going to necessarily say these things in order, but I'm going to just read from my PAC system. This is not necessarily in order. I believe I previously shared, but did not have access to the cervical spine radiographs performed at OSMC in Goshen on June 23, 2017. I had access to a cervical spine MRI performed at OSMC in Goshen on June 23, 2017. I had access to the earlier studies that I would have had access to were from, or that I did have access to in terms of actual physical imaging was June 23, 2017. I then had an MRI of the cervical spine. Forgive me. I had a fluoroscopic image of the cervical spine from January 26, 2018, MRI of the cervical spine from February 20th, 2018, MRI cervical spine July 31st, 2019, CT cervical spine July 31st, 2019, x-rays of the skull from October 9, 2019, cervical spine radiographs from October 23rd, 2019, February 19, 2020, May 27, 2020, September 9, 2020, September 8, 2021, and January 17, 2023. These are not my records, but I believe our pre-employment chest x-ray, which appears in the PAC system, this was not actually, strike that. That's not my patient. So the last x-ray I had were from September 8, 2021.
Okay.
Sorry, I'm trying to dig deep into my PAC system. I wasn't ready for that question.
Okay.
Let me just do one more thing here to make sure that I'm looking at this properly. Okay, yep, that's
Make sure it unscrews.
correct.
Okay, doctor, if a radiculopathy results from a traumatic injury, would you expect it to develop immediately or show up several months later?
It could be either, as I've stated.
And just to confirm, you have not had access to his chiropractic records that predated this accident?
Go to my original note. What I will share is that I'm not looking in my medical records right now. If you want me to verify that, I can access my medical records. I'm referring only to my original clinic note in answering this question because I otherwise don't recall unless I go to my EMR. When I first evaluated the patient on September 7, 2018, he noted that he had had a number of treatments, including medications, physical therapy, cervical, epidural, steroid injections, and I believe that's what he shared. I don't have those records in front of me. If you want me to be meticulous about this, I'm happy to open my EMR and see if those records exist in my EMR. But it does not
If you're
appear that I
drunk enough,
reviewed them
it does.
thoroughly on the date of my evaluation with him, which is the first date evaluation, September 7, 2018.
Let me ask you this. Would it be relevant to your medical history of Mr. Jackson to know if he had a history of neck pain and chiropractic treatment per se?
It's not irrelevant. I mean, if I had known that, I would have likely listed it and would have placed it in my documentation. But again, I'm not paying any judgment on that one way or another. I think if he hadn't had that, or if he had had that, I think I just would have written it down.
If you had known of that history, and if you had been advised that radicular pain started after a chiropractic session several months after the accident, would that have affected your opinion about whether he was telling the truth about what caused the neck pain?
I'm going to restate your question just so I make sure I understood it.
Sure.
You're stating that he developed neck pain after a chiropractic manipulation for the first time?
Well, let me represent to you that the records reflect that he had been having chiropractic treatment for his neck for years prior to the accident, and that the radicular pain started during a chiropractic session several months after the accident. Would that have affected your opinion about causation of the neck injury for which you performed surgery?
Forgive me. I mean, I find it hard to speculate upon records that I'm not a party to. I'm not sure if that's fair for me to make an opinion about that. I don't think it's wrong to state that for the record or ask me that question. But again, to my knowledge, I've never been part of those records.
Okay.
It's okay to push me for the answer, but I just don't have a great one, and I'm sorry.
Okay, that's fair. Thank you, doctor. I'll pass the witness.
And if those records did exist and his treatment was not in the area in terms of the cervical spine, I guess that wouldn't be of a concern to you either, right?
Want to restate that question?
Yeah, I'm sorry. Let's say these physical therapy records exist, but
Chiropractic records, you mean?
yeah, chiropractic records, but he is treating a different section, not where you had treated. Would that cause you any concerns?
I'm going to try to restate the question, and I'm sorry if I misunderstood one or both.
Let me try.
It's fair to say that patients can have care under a chiropractor for things that are unrelated and or related to what I treated him for. I guess all I'm sharing, I hope as respectfully as possible, is that I'm not a part of these records. I haven't developed opinion around it. I'm also sharing that it's hard for me to develop an opinion around records I don't have access to.
Fair enough. And I think you've said that you believe Mr. Jackson to be an honest person.
I did.
Okay, and when you first met with him, you asked him questions. Okay, and when you first met with him, you asked him when his symptoms started. Is that right?
Correct.
Why is that important to know?
I mean, we want to know as treating providers, and when you first perceive these concerns, what he thinks started it. One principle in healthcare is that the patients are usually able to tell you what's going on with their health with some degree of accuracy. And that doesn't mean that we don't further investigate those concerns with questions or diagnostic tests or even treatment. But that's the whole point of taking a history, which is subjective. We want to understand what the...
Yes. So yeah, we're on cross now. So they're reading from a transcript. The first lawyer's done, and now the next lawyer is doing his part, and then we'll be done with Dr. Schmucker.
patient thinks might have happened. We want to understand what he's tried as much as he can share that with us. It doesn't mean that it's necessarily an all-inclusive narrative either. It's just what he shares with us at the time we see him. And it helps us understand maybe what some of the prior concerns are and what if some of his prior treatments are. For example, in that same visit, he shared that epidurals had not worked for him for the second or third. And so, that affected some of the recommendations as to further treatment and moving towards a selective nerve injection, for example.
And when you had asked him when his symptoms started, he had advised you that those symptoms had started after his car accident about 2 years prior. Is that right?
That's correct.
And he advised you that he'd had pain off and on since the car accident.
That's correct.
And he specifically told you that the pain was after. And he specifically told you that the pain was after that car accident, not before that car accident. Is that right?
Correct. He shared that it was following a motor vehicle accident.
So he was attributing that pain to those injuries to the car accident.
That was my impression, yes.
And you have not been provided with any records that Mr. Jackson had any neck injuries or any neck problems prior to the car accident. Is that right?
I have not.
Are you aware of whether Mr. Jackson knew that he had Klippel-Feil syndrome prior to the accident?
I do not know whether he did or he did not have that knowledge, no.
Okay, now, the first time you saw him was on September 7th of 2018?
Correct.
Do you recall that?
I do.
Yeah, okay. And so going to page 71 of your records, that specifically says the history of his present illness was that, quote, this pleasant 39-year-old male who presents today for a second opinion, as referred by Dr. Caldwell at OSMC. Patient's chief concern today is neck pain that radiates into his right upper extremity, pain which has been present on and off for about 2 years following a motor vehicle accident, unquote. Would that have been in terms of how you learned when his symptoms started, when his pain started? That's when he told you that, and you put that in your records.
Correct. That's how I learned, and that's correct. That's also how I documented it.
Okay. And so you said that you had taken his word for it, and there was no reason that you had to question his representation of that, right?
Correct.
And so he told you that he was injured in the car accident. You had not seen any evidence or been told by anyone that he had any pain before the accident. So, I mean, based upon what you do know, not speculating about what you don't know, based on what you do know, which is that you haven't been told or reviewed any evidence that he had any problems before this with his neck. And he tells you when it develops, wouldn't you have to agree within a reasonable degree of medical certainty that the accident caused his injuries or at least aggravated his pre-existing asymptomatic conditions.
I mean, generally speaking, I would say that's correct. All I can share is my documentation and my opinion as a reflection of what he shared and the data that I collected. I certainly don't have, other than potentially records which may have come to me from OSMC, any other things. But generally speaking, in my practice, we do try to collect our own data as well. And that data comes from what patients share with me, and then what we would find from our investigations. Again, I had no reason to believe that Mr. Jackson wasn't being truthful with me. And there are certainly circumstances where even with baseline degenerative disc disease or spondylosis or even stenosis, where a patient can go from asymptomatic to symptomatic. As I've stated, that can certainly be associated with an event such as an accident. And in some circumstances, it can start spontaneously without an obvious external source, such as an accident. In this circumstance, once again, I took Mr. Jackson at his word, and therefore I wrote it as such.
Okay. Now that we're all terrified of getting back fusions, tomorrow gets better. Tomorrow gets better. I think it's cool. I think it's pretty cool. And then we get the verdict, which is pretty cool too. Let's go to Judge Fleischer. I'm trying to remember if I need to skip any today, and I don't think so. I don't think there's anything I need to skip today. I think we're good. I'm just getting to the first person. I think he has new sayings today, guys. I'm not sure, but I think he does. There he is. There he is. We're back to normal. We're back to normal. Stuck like Chuck. Yeah, that would be a new one. Oh, man. I've never heard that before. I hope he says it. We have to decompress from medical talk. The doctors have nothing to do with this case. The doctors are just saying doctor stuff. What has to do with this case mostly is what we see tomorrow and what these guys testify to tomorrow. That makes this case a little iffy. Yeah, so guys, Victoria called me today 3 times. You want to know why it was 3 times? Because the first 2 times I just hung up. I didn't know who that was. I just hung up the phone. She says, "This is 911. Do you have an emergency?" And immediately I thought, oh my God, my son called 911 again. I don't want to have to do this. So I thought, oh God, my 911's going to charge me money. They're going to make me pay money because my son called 911 again. And then I thought, wait a second, they're calling me. Call them. And that's definitely not 911. And then I heard Melissa in the background laughing. And then I knew it was Victoria and Melissa on the phone. Yeah, but I don't normally answer the phone. So when it rang, I looked and I hung up. Then it rang, I looked and it hung up. And then it rang and I thought, okay, maybe I should answer the third one. Maybe I should. All right. Let's go to Judge Fleischer. Let's press play. Oh, corporate law number 5. How are you today? Uh-oh. Here we go.
Elijah Nichols. Mr. Nichols, you're charged with criminal mischief. You're facing up to 6 months in jail and or a $2,000 fine. We're going to do probable cause. You have the right to remain silent. Anything you say can or will be used against you. You have the right to have an attorney present. If you cannot afford one will be appointed to you, sir.
On August 22nd, 2024, in Harris County, Texas, the defendant who was staying with the complainant was upset because he wanted her to get off of him. Complainant stated that the defendant elbowed her in the mouth. Complainant asked the defendant to leave, and the defendant agreed to leave. The defendant left the apartment with his belongings and waited around the corner to be picked up. Defendant came back to her apartment. Defendant was still on the property and the complainant began recording him with her phone. Defendant grabbed her phone, threw it on the floor, and broke the cell phone. Complainant states that the iPhone was worth $300.
Mr. Nichols, I'm gonna find that there's probable cause to go forward with your case. Do we know if she wants to have contact with him? Or no?
Do not have, give me 1 second, let me double check.
Okay. Mr. Nichols, I'm making a bond conditions on you now that you're not to have contact with this person and not to be in possession of weapons. Do you understand? If you violate these conditions, I will issue a warrant. I'll put you in jail. You will not get any more PR bonds. What do you do? How old are you? What do you do for a living? Where do you work? Okay. Did you graduate from high school? Okay. Who do you live with now?
Right now,
What about mom and dad? Why'd you come here? Uh-huh. Okay, where's dad? In West Texas?
No, same place. The incident.
Okay. Okay, I'll appoint you a lawyer today, Mr. Nichols. I don't want any more issues. If that's a bad place for you and you know better than anyone else, then don't go back. Because we don't want you to get in more trouble and, you know, the likelihood of someone ponying up at $5,000 to $10,000 bond for you is probably not very high. So if we have to put you back in jail and make your bond 5,000 to 10,000, you don't have anyone to post it up. Guess what happens? You're stuck like Chuck until this thing is over with. And I'm telling you, it takes a long time just to get evidence. You understand? So for now, I'm going to have you go to Victoria. We'll have you sign a reset. I need you to fill out an application for me, but I'll appoint you a lawyer today and we'll have you talk and we'll figure out the situation. Okay? As it stands, no.
How do you know there was a payout? That lady lawyer might be doing her job, you know. And I can't tell you what the payout was, or if there was, or if there wasn't, because we're not there yet. Patience, young grasshopper.
Contact with the complaining witness and no weapons. You understand? Okay, please. So can you file no contact and no weapons, please? Thanks.
All right, Judge.
I reached out to the complainant, she didn't answer. I reached out to the complainant, she did not answer, so.
Got it.
Fozzie, nobody tells Victoria what to do. I would never say that to her. Tell Victoria what to do. That's crazy.
That's why, you know, I want to honor the wishes of the complaining witness always. So if she or he does want to have contact, then we'll do no threatening or harassing. But if we don't know, then just no contact. Okay. Thank you. Nathaniel Reams. Mr. Reams, you're charged with. Good try. Mr. Reams, you're charged with unlawful carrying of a weapon. You're facing up to a year in jail and or a $4,000 fine. We're going to do probable cause. You have the right to remain silent. Anything you say can and will be used against you. You have the right to have an attorney present. If you cannot afford one, one will be appointed to you, sir. Okay.
On August 22nd, 2024, officers observed the defendant's vehicle with expired registration driving with his high beam headlights on while opposite traffic was present. Officers conducted a traffic stop. Upon approach of the vehicle, officers could smell the overwhelming odor of marijuana emitting from the vehicle. Officer observed an AR-15 style pistol and
AR-15.
in the backseat in plain view. Officer then detained the defendant. Firearm was recovered. Defendant was observed to not have a valid driver's license. Defendant was observed to be under the age of 21. Officer then recovered 1.27 grams of marijuana from the center console of the vehicle.
I'm going to tell you now, if you think this is going to go easy, you are sorely mistaken. Mr. Reams, I'm going to find probable cause. And I'm now sending you for a drug test. I want you to come back. If you don't come back, I'm going to set your bond extremely high. I will issue a warrant for your arrest. Do you understand me? As it stands now, you're not to consume alcohol, illegal drugs, unprescribed controlled medication, and no weapons. Do you understand? Did you graduate from high school? How old are you? What are you doing with your life now?
Right now, I'm just trying to go back to school.
Okay, so this is what we're gonna do. I'm gonna have you sign a reset with Victoria, and then I'm gonna have you meet with Rachel right now. We're gonna send you for a drug test. You must come back, and then I'm gonna appoint your lawyer, and we're gonna go further. No more dope, otherwise I will put you in jail. Do you understand? Okay, come on. Oh, one more thing. No, do you have a Texas driver license?
I have a permit, I have 2 permits, and I have a driver's certificate.
How are you getting to point A to point B? Because you're not allowed to drive at this point. Until I know that you have a license and liability insurance, I'm ordering you not to drive. Do you understand? So who's taking you to go do the test? Is your mom here now? Does she know that you're charged with this offense now? Does she know that you have an AR-15?
But no, sir, she didn't know about this.
She doesn't know about this?
She knows about the incident.
She knows that you got arrested and you're charged? I'm gonna have you sign this affidavit with me today. Unless I know that you have a Texas driver license and liability insurance, you are not allowed to drive. I will let you take the driver's test, but that's it. Until you have a physical copy, you're not allowed to drive. And if you do, I will have a contempt hearing. You'll be facing an additional 6 months in jail and a $500 fine every time you drive. Do you understand? So I'm gonna have you come swear to this, and then we're gonna send you for your drug test, and we'll see you here in an hour. Get on it.
Find me. I won't be home.
Right, sorry. Shoot, it's already signed. No?
No, I don't see inside.
What? Oh, let me see. Hold on a second.
Judge, what is the name for this one? What cause number?
On which one? This gentleman? I don't know.
This is Mr. C. Strunk. Page 20 for you, Your Honor.
Do you still need the cause number? You got it. You got it? Okay. Okay, so this is for him. No, I don't want to do that. No, just yet. Are you Duran C. Strunk?
Yes, sir.
Sir, you're charged with unlawful carrying of a weapon. You're facing up to a year in jail and or a $4,000 fine. We're going to do probable cause. You have the right to remain silent. Anything you say can or will be used against you. You have the right to have an attorney present. If you cannot afford one, one will be appointed to you, sir. Okay.
August 21st, 2024, officers conducted a traffic stop on a truck for making a right turn without signaling. When officers approached, they observed the smell of marijuana. Defendant was the sole occupant of the vehicle, and defendant admitted to having marijuana under his seat. There was a probable cause search there was a search that returned a pistol with a bullet in the chamber under the driver's seat and a plastic bag with the usable amount, which was not specified, of marijuana.
All right, Mr. C. Strunk, I'm going to find that there's probable cause to go forward with the case. Do you have a valid Texas driver license, sir? Do you have valid liability insurance in your name? Then you're not allowed to drive. I am now making that a condition of your bond. Until you have liability insurance and show us that you do, you're not allowed to drive. I'm also making it a condition that you're not to be in possession of your weapons as well. How old are you, sir? What do you do for a living? For what? And you don't have insurance and you're a driver, a professional driver? Really?
We just momentarily lost insurance at the time.
Okay, no driving. I'm making that a condition. Mr. Seastrong, if you do get liability insurance with your name on it, come back, I'll allow you to drive. But all I'm asking you to do is follow the law. I'm not asking you to split the atom here, you know? The law says that when you have a car and when you want to drive, you have to have insurance. You know what happens if you go out there, you have a wreck and you create $50,000 worth of damage? Who do you think they're going to come after? You personally. They will attach everything you own and go after you for everything. When you have insurance, you pay for a lawyer to represent you, and the insurance company has a duty to represent you if you are in an accident. I'm going to have you come up here, swear to us that you're not going to drive without liability insurance and court approval. After that, I'm going to have you go to Victoria, sign a reset. After that, we'll have you take a seat in the jury box while we get your bond conditions. We will have you sign bond conditions, promising us you will not have any weapons. And after that, we'll let you go. We're going to give you a month. Please start looking into lawyers, sir. You need one to represent you in this case.
What?
This one.
When? What? Huh?
Page 22, garage, come on up.
Hey, Stephen,
Hi, Fletcher.
Stephen, you want to give this? Thanks. Are you Tiara Thrash? Ms. Thrash, you're charged with assault of a family member. You're facing up to a year in jail and or a $4,000 fine. We're going to do probable cause. You have the right to remain silent.
Who's he? I missed who he was. I need to. Don't say that. Who's he? He said there was no mods in the judge's stream. Who is he? I'm hoping for a few names here. It wasn't none. It wasn't. First off, I think she's a grandmother. Oh, I thought Micah was calling you out, man. Can I just say one thing about this person right here, Nan? So we moderate Judge Fleischer's stream, and it's not always easy when a comment comes through. Sometimes they're like towing the line. And, you know, sometimes we get it right and sometimes we get it wrong. And sometimes we block comments from people for no reason, by accident. But we never know. Gosh, was that okay? Was that not okay? Some of them, it's crystal clear. That comment's got to go. Other ones, who knows? But every day we work. Every day we work on that stream, and we try to keep it, you know, as nice as possible there. None supports all the mods every day. As soon as I do something that I'm like, oof, I don't know, should I have done that? There's none. Thank you, mods. Thank you, mods. Thank you, mods. And it really makes us it really is lovely for you when you say thank you. And I, you know, we don't know what we just don't know. And we do it, and then you're like, thank you, and we're like, okay, yes, this is what we should be doing. This is a good thing. So we appreciate you. All of the mods there appreciate you, except for Fozzie. All of the mods there appreciate you. Thank you.
Anything you say can or will be used against you. You have the right to have an attorney present. If you cannot afford one, one will be appointed to you.
The complainant and the defendant are married in this case. On July 24, 2024, law enforcement officers were dispatched to a disturbance. / an unknown weapon.
Let's talk about that for a second. So, freedom of speech, yes. Freedom of speech everywhere. You wouldn't walk into like a church on Sunday and start reading the Kama Sutra. So there's a time and a place, and here's the problem with Judge Fleischer's chat. Here's how we're on a knife blade. We're balancing on a knife blade because Judge Fleischer can shut that chat down at any time. There's no First Amendment rule that says he has to have a chat up at all. Second, YouTube can shut down Judge Fleischer's channel at any time. They don't care. Trust me on that. They don't care. They've shut down judges before. So when you're in that chat room, you have to follow those rules because they'll just take it all away. Period. They'll just take it all away, and they can, and they will. It's so we just have to respect that courtroom. And you can have your First Amendment right anywhere else in the world. Like I do.
Weapon code call for service. Defendant was gone on arrival. Law enforcement officers saw red puffiness on the complainant's face, consistent with signs of an assault. Complainant and the defendant had a verbal argument during which defendant called complainant a fat bitch while turning away. At that moment, defendant allegedly began hitting her from behind, striking both complainant's left and right cheeks. Upset, complainant admitted to using a flower pot to break the window of the defendant's vehicle. Defendant then returned to the apartment and struck complainant approximately 4 times. While complainant was on the ground, blows mostly connected with her shoulder and her arm. The complainant felt pain.
Mr. Ash, I'm going to find that there's probable cause to go forward with your case. I'm ordering you as a condition of your bond not to have any contact with the complaining witness in this case and not to be in possession of weapons. Do you understand, ma'am? A protective order has been issued in this case. I suggest that you get to know it because if you violate that protective order, the state can and will file a violation of a protective order against you. It's one of the worst cases you can pick up. What do you do for a living, ma'am? You're a truck driver. Do you have a CDL? Okay, we are going to reset your case to give you time to hire a lawyer. So I will have you go to Victoria, sign a reset. You're a truck driver. Truck drivers make a lot of money. What are you talking about? You can't afford one. Sorry? Why not? Well, when is the last time you've worked? Since February. We're now September. How do you support yourself? You got to get money somehow, Mr. Ash. I'm trying to figure out how are you, So how much money would you say you make on a monthly basis? You keep giving me elusive answers. I'm not going to appoint you a lawyer. I need to have numbers. I mean, what I can do is I'll give you an application, but if you come back to me and put all zeros, I'm going to send it right back to you because that's just not true. I'll give you an application, but you need to fill it out and fill it out correctly. This is a court document that you're going to swear to. So if you're not honest on it, I'm just going to send it right back to you. Do you understand? Okay. Deputy, do you mind giving an application? And then I'm going to have you sign a reset and we'll have you take your seat in the jury box, man.
Right this way, please. All right, Judge, you ready for the next one?
Yeah.
Page 24, Wale, come on up.
Victoria yells to us every day. Thank you, Victoria.
Angel Wale. So you're charged with driving while intoxicated. You're facing up to 6 months in jail and or a $2,000 fine. We're going to do probable cause. You have the right to remain silent. Anything you say can or will be used against you. You have the right to have an attorney present. If you cannot afford one, one will be appointed to you, sir.
On August 21st, 2024, defendant was speeding as he approached an intersection in Harris County, Texas. The defendant slammed on his brakes, swerved into another lane, and nearly collided with the arresting officer in another vehicle. The officer made contact with the defendant, and the defendant tried to evade and struck a street sign. Upon arrest, the officer observed glossy eyes, slurred speech, the strong odor of alcoholic beverage, and the defendant unable to keep his balance. The defendant did not consent to a standard pro sobriety test. Defendant was read his DIC 23 and he consented to a breath test, a breath exam. After the breath test, the defendant at JPC did not comply and started to resist by using his body weight to sit in a different area. The defendant was then placed in a single man holding cell. Officer then executed a blood warrant.
Only I'm gonna find that there's probable cause. Do you have a valid Texas driver license? Do you have valid liability insurance in your name? You run his license, please. I'm ordering you as a condition of your bond not to consume alcohol, illegal drugs, or unprescribed controlled medication. I'm going to randomly test you. If I find that you're using, I will put you in jail. You will not get any more PR bonds. Do you understand?
Yes, sir.
How old are you, sir?
I'm 21.
What do you do for a living? Wonderful.
I was working for Uber for a while.
Uber? You're a welder. What the hell are you doing Uber for?
I just graduated on July 7th.
Do they not have like a job search or some kind of?
I was having problems with substance abuse before. I decided to put all of that away a year ago when my dad passed away. I still struggled with alcohol, but I've been doing better for so far. But
Not now. This is better.
it was in a while ago. Yes, it is. I made a lot of mistakes back then, and I was doing Uber for a while to pay for my school, and then I got a second job at Planet Fitness, and right now I am looking for a job in welding.
That's the best bet. Because I'm telling you, if you can get a job welding, you can make a boatload of money. You know, they have underwater welders. It's only 150,000 a year, man.
Yeah,
I mean, it's sick money that you can make, right?
So as a pipeline welder, that's my dream to be.
So did this welding school not have a career placement that you could work with?
I think like 3-5 prior to my arrest, I had went to the school to look for jobs, and they gave me a couple papers, Southwest Shipyard, and another. I got arrested.
When did you graduate?
On July 7th.
Okay, we're now in September, okay? So don't start blaming all this on your arrest. You just got arrested. So I'm going to put a monitor on this gentleman. I'm putting a monitor on you so that I know that you're not consuming alcohol. I want you to understand that I'm giving you a portable device so I know that you're not consuming alcohol. If you have a problem, you better address it yourself, because if you don't, I'm going to do it for you. And I promise you're not going to like the way that I do it. You understand? Usually when I do it my way, I will put you in a rehab facility in the jail. And it's usually about 9-10 months, depending on how well you respond to treatment. So we're going to do this. It's whether we do it the easy way or whether we do it the hard way. And that depends on you. I will give you this opportunity now to try it yourself. And if you're incapable, then we'll do it my way. Do you understand?
Yes, sir.
When I mean no alcohol from any source: cakes, candies, foods, gums, hair dye, a tequila lollipop. I've heard it all and I don't care. You come up here and try to tell me that Bambi was in the woods trying to give you some, I don't care. You understand? I'm also making a condition that you get a full-time job. Because when you have too much time on your hands, you become self-destructive, and you now see how that's happening. If you have grief, you need to face it head on. don't beat around the bush, because all you're gonna do is you're gonna kill yourself in the process. You fight it head on, you deal with the grieving, and you have to find a creative or a good outlet for that, for the sadness, the anger. Some people exercise, some people take up sports, some people take up knitting, whatever it may be. You need to find something constructive that's good for you, not something where you're going to kill someone on the road. You understand?
Yes, sir.
Judges.
So, what other priors? Do you have any prior DWIs by chance? Okay. We'll do a portable. Yeah, and waive the fee, please. Today. Would you like me to appoint your lawyer, Mr. Wallen?
Yes.
Okay. Do you mind giving him an application? I'm gonna appoint your lawyer, but I'm telling you now, there's no excuse. You're on notice of what you can and can't do. One false move, I'm keeping you. And I don't care if you're kicking and screaming and crying and you blame it on whatever it may be. I don't care. You understand?
I'm not gonna blame for myself.
Okay, all right, come on.
Judge, page 27. Nova.
Tolkien Zaklanova. You speak English, man?
Yeah, I speak English.
Well enough, or would you like a translator?
No, I don't need translator.
Okay, ma'am, you're charged with assault of a family member. You are facing up to a year in jail and or a $4,000 fine. We are going to do probable cause. You have the right to remain silent. Anything you say can or will be used against you. You have the right to have an attorney present during questions and interviews with the state of Texas. If you cannot afford a lawyer will be appointed to represent you, ma'am. We're going to find out what happened to see if there's enough probable cause. If so, we will go from there.
In August 20th, 2024, law enforcement officers responded to a disturbance with a weapon at 1812 South Bismarck Road in Harris County, Texas. The complainant came home from work late, and as soon as he entered the house, the defendant started yelling and screaming at him, and they began to argue. The complainant stated during the argument, defendant then hit him in the face 3 to 4 times, both with open palm hands and closed fists. Complainant stated he does not remember the exact number of times that the defendant hit him or how. The complainant stated that the defendant was the one who started the physical altercation. Complainant stated he did not defend himself and he did not put his hands on the defendant. He just let the defendant hit him. The complainant stated he did feel pain when the defendant assaulted him. Complainant stated that the defendant needs help and is very intoxicated. Law enforcement officers did not find defendant to be credible because her behavior was very erratic and she was inconsistent in her narrative.
Any alcohol? Did she have any alcohol whatsoever?
No, not that I see.
Okay. Ms. Saklanova, I'm going to find that there's probable cause to go forward with your case. Do we know if he wants to continue to have contact with her or no?
So Your Honor, for the writ, he said he wanted a cooling off period, but he's okay with contact, so we would ask for not threatening or harassing. As well as in the writ, at least the complaint alleged that the defendant went out for dinner before and got drunk and was intoxicated on the.
That's fine. Okay. Ms. Zaklanova, I want you to understand that I'm putting conditions on your bond at this time. What that means is that
May I say?
you will just let me finish and then I'll let you ahead. So what I'm doing now is I'm putting these conditions on your bond. If you violate these conditions, I will revoke your bond and I will put you in jail. Okay. The first condition is you are not allowed to consume alcohol or illegal drugs. The next thing is that you are not to have any harmful or offensive contact with the complaining witness in this case, who is Ronnie Bo Slayman, I'm sorry, right. You're not to have any kind of harmful, offensive, threatening contact with this person. You're not to be in possession of weapons. There is a protective order that has been issued in this case, and you need to get to know it, because if you violate the protective order, the state will file additional charges against you. So you have to read it and get to know it. How old are you, man?
35.
Do you work?
Yeah, I have 2 jobs. I work without any day offs. I work hard. I'm a photographer and I'm a server.
You need a lawyer to represent you in this.
I want to complain on him. I didn't hit him. I'm a lawyer. I know what I did. I remember everything. I want to complain. I want to protect all future his ladies because he's dangerous. He has a gun. He showed me a few times that gun. I didn't hit him. I remember.
So hold on. So you have the ability to hire a lawyer. Do you have enough money?
Right now, I don't have extra money. I used to rent a room in his house. The police officer, I know they checked everything. They've seen all my stuff in my room.
I don't want to talk about the case.
Okay.
We have a bunch of district
I don't
attorneys
have
here.
extra money right now. If you let me to find a lawyer, I want to complain. I want to write down complaint on him. And I want to
Let's do
protect
this.
other people. Okay,
I can give you a lawyer today,
please.
a lawyer
Please.
today. You can explain your side to the lawyer, and then we can try to figure out some kind of solution. You're not living there anymore, are you?
No, I'm homeless right now because of him. I'm homeless. I live for free with my friends. I'm looking for a new place to stay. They let me to live till August 31 for free. Right now, I'm looking for a place to stay.
I think that it's better to have no contact whatsoever at this time, okay? I don't think at this point it's good for you to have contact with this person. So what we're gonna do is I'm ordering you not to have any contact with this person. Stay away from this person.
Okay, no problem. I don't want to see him anymore. I want to see
Great.
him in a court.
Well, there are other courts for you to, when we give you the lawyer today, the lawyer can advise you how to take any kind of civil action against him if you still so, desire.
I'm not gonna be quiet, sir. I'm gonna tell everything what happened before in that house.
Okay.
I want to tell
I'm
everything.
not gonna be
Okay.
quiet.
Do it to the lawyer,
Yeah.
okay? So for now, I'm gonna have you go to
To the
Victoria,
lawyer.
sign a reset. We will have you take a seat in the jury box while we find you a lawyer. I have an affidavit here, so don't worry about it. Yeah. And then do not leave until you sign our bond conditions, okay? You're gonna have to meet with Rachel so that no alcohol, no drugs, okay?
Okay.
Please.
Right this way.
Your Honor, I filed 2 motions for bond conditions. The first one can be ignored because I have to modify.
Yeah, I'm gonna,
Yeah, okay.
Judge, that was the last arraignment.
okay. Hey, Herman. Hey,
Hey, Mr. Casey. Congratulations and thank
what's the
you.
last name?
Oliveris Perez.
John, before
He
recess.
just needs a couple weeks, so we got him the application a little late, so we're just gonna set up for DPIH, if it's okay with the court.
It's 207 day. He's done his TRAS?
Yes, sir.
He's not given everything to you?
Well, it was, we didn't give him the application until this week, full transparency, because we didn't know he had done the TRAS, so he'll be able to get everything. We'll get
2
it set up
weeks.
for DPIH.
2 weeks. If he doesn't have it done in 2 weeks, I'm bringing him back day for day.
Sure.
Okay.
Nichols.
Nichols?
John, before recess.
So, hey, Herman, does he need to do a mitigation packet?
No, sir.
No? Okay. Hey. good.
I'm working on Barry Felt at the LD.
Okay.
She just took his drug test. A couple days ago, he tested positive allegedly for MDMA and weed and meth. Today, he's tested negative for the weed and the MDMA. He's telling me he's clean.
I'm gonna give it to Monday.
Is there any way you consider once a
Sure
week drug
did.
testing?
No,
I did.
nope. He's gonna have to test on Monday, and I wanna see that it better be negative on Monday. If it's positive for meth on Monday,
John, before recess.
he knows where he goes, that he's continued to use. Because by then it shouldn't show up in his system unless he's
Well,
continuing.
it would be less than a week.
It'll be over a weekend. Meth stays in your system 3 to 4 days,
Okay, I didn't know that. So okay, we'll see. We'll see Monday.
just a little bit over cooking.
So you did say that he could go to Quest to get tested.
Correct.
Could we get a reset then to Thursday, or how should we get a reset?
Yeah, I guess so, right. But remember to tell him that he's got to have the test into us on Monday at some point, and like it's got to be in our hands.
Yes, Judge, and he's doing NA meetings as well. Thanks, Judge.
Council for recess?
And Vic, if he doesn't have everything turned in by the next setting, day for day until he has it, because it's 207 days. Do you mind handing me this to the bell?
Council for reset?
And just put it here and I'll give it to you. Okay, you might hand it to me, please. Thanks. Oh, it looks like it was dismissed.
This is when Fozzie made the judge leave. We were all having a good time. Oh wait, Fozzie wasn't here today.
Mass conference of Decompression.
Just let me know where it goes. I will.
Hey, Judge, can I approach that, please?
Yeah, is this Swayzer?
Yes, sir.
Ordering the form.
Does anybody know what that pin is? He's had it for a
Mr.
while.
Mr. Swayze, you're
How
charged
did
with
you
two
tell him?
cases. You're charged with unlawful carrying of a weapon while intoxicated and the possession of marijuana.
Order in the court.
I already have. First thing I did today.
You've worked out an agreement. They're offering you 6 days in jail with credit for the 6 days that you've done on the gun case. They're going to dismiss the weed case. Is this how you understand it? You're giving up the right to a trial, right to compel witnesses to testify on your behalf, confront and cross-examine your accusers. If you're not a citizen, there are possible immigration consequences. You can be deported, excluded from the country, denied naturalization. You give up the right to appeal. I want you to understand, Mr. Swayze, that this, you will be forfeiting the weapon by doing this. You will not get it back. If you come back here, you will be facing a minimum of 90 days in jail for any cases that you pick up. Do you understand? We don't have to do this if you don't want to. I mean, you give me attitude, we'll just put you to trial, man. The only thing I'm going to impart to you is that if you like to get mucked up, probably the worst thing that you can do is have a weapon, because God forbid you do something in a state of, and you dig yourself in a hole by committing an act of murder or aggravated assault that you do. Not, you're going to get out today, right? But hopefully nothing happens to where you really dig yourself deep, Mr. Swayze. You know, stay home. How do you plead to the offense, sir? We'll find you guilty, send you to 6 days in jail. I'll give you credit for the 6 days. The weapon will be forfeited. Good luck to you, sir. Thank you. Yes. Hi, Anna. Good morning. Hi, Amy.
I'm here on Sean Salvo Boyton. It's a fugitive case.
Is this from yesterday, right?
Yes. there was, he signed the waiver. We were gonna bring him back today to see if he wanted to keep it or withdraw. He wants to keep the waiver.
Okay,
But there was an issue with the initial one that he signed yesterday. And,
not a problem.
okay,
So he'll keep the days that he's earned.
correct.
Yeah, okay, great. Okay,
And the one on the bottom on the legal side is the old waiver, so just to let you see the issue.
Yeah, that's just the one, the longer one is the one yesterday. It's basically the same, it's just the legal date is the 29th.
got it. Okay. You want me to trash it or keep it?
I can keep it, it's actually.
Okay.
Thank you.
Thanks, guys. Thank you.
I have Todd Miller on docket, and also I filed a motion to withdraw.
Is this,
This is.
is this person on the land?
Yes, it's been,
Okay,
I think, 3 months. And then
got it.
Okay. Check in. Thanks.
You said who?
Todd Miller. And I believe there's a BVR. He was picked up a felony and bonded out yesterday.
Damn it, I tried to get him here.
Yes. I just spoke with him and said he can be here tomorrow morning. He was supposed to be on docket yesterday and then down from the felony courts, and then he bonded out.
Tell me they gave him a PR bond on the assault.
On the land means they just can't find him.
Okay. I'll set it for bond forfeiture tomorrow. Please let him know if he's not here, then I'm gonna revoke his bond, huh? Okay, so Miller, SFDF tomorrow, please. Okay, thanks, you. Take care. Oh, where did it go?
Oh,
She's
Love you,
processing.
Rebecca, Thank you.
So I guess this is just, it's moot.
Yeah, it's nothing. You can put it on the case itself, but it doesn't matter.
I guess if you wouldn't mind filing.
I think she was under the impression that it was still active.
It is a state jail, right? But it got dismissed
Well,
in the 180.
I mean, the North Court was the out of county case, which was.
Hello?
My kitten is crying. Hold on.
Hey.
Be good.
So you didn't get it either.
Fozzie, you leave Casey alone. You don't get no First Amendment right here. Your First Amendment right ends where her nose begins. Don't pick on her. You could just move over a little bit. Could you just move over? We both get on, please.
Whichever one's older, but.
Oh, that's fine. That's fine.
Yeah, so that's. One of them was also basically beats up his daughter.
I knew where I was. Look, the courtroom's empty. That's my bad. Here we go, Judge.
Morning, Mr. Gutierrez.
Good morning.
Sir, you're charged with criminal trespass. You're facing up to 6 months in jail and or a $2,000 fine. You've worked out an agreement. They're offering you 3 days in jail, credit for 2. So you're done today. You'll walk out of here today, but you need to understand that this will go on your record. It'll be there for the rest of your life. From now on, you'll be facing a minimum of 30 days in jail for any cases you pick up, and you're on notice. If you go back to the same location that you went to now, you're gonna come right back over here. Do you understand? You give up a lot of rights by entering into this agreement. You give up the right to a trial, right to compel witnesses testify on your behalf, confront and cross-examine your accusers. If you're not a citizen, there are possible immigration consequences. You can be deported, excluded from the country, denied naturalization. You give up the right to appeal. So once you plead guilty, there's no turning back. This is what you want to do.
Yes, sir.
How do you plead to the offense or guilty or not guilty? I'll find you guilty. Follow the agreement. I will roll your car costs so you won't owe anything. Good luck to you, sir.
Thank you, Your Honor.
Where?
fun.
See you on Zoom tomorrow. I've got one future case.
Okay, great.
If I don't, have a good
Have
weekend.
fun. Where are you going?
Nowhere.
No more vacations, huh? Nice. Where are you going? It's the life. Nice. I live vicariously.
Good job, Sebastian.
I have a list of names. So, okay, here's what we do. All right. We bully the men out loud. But I have a list of names of some of the ladies that I don't particularly agree with all the time. And it's okay, because I just bully them in my head. Like when they post something, I respond mentally. I'm like, why don't you shut up? But we don't say it out loud, because if I would say something to a woman in the chat, that is forever. Forever I have said that. If I said something to Fozzie, tomorrow he would forget all about it and he would be fine and we would be perfectly fine. But you can't do that. I can't say, what if I said something elitist? Let me tell you, it would be forever. There's no unless. Now there is an unless, okay? There could come a time where we get together and then I say, oh my God, I shouldn't have said that. I'm so sorry. I must have hurt your feelings. Like I will let her know, this other woman, whoever she is, that I understand how what I did affected her, whether it was true or not. It affected her in some way. I know she felt a way because of something I did, whether I meant it or not. And then she, when she hears that, then she feels bad for me for feeling bad. So she's like, oh no, it's okay. No, everything's fine. At that moment, then all is fine. But it takes 3, 4, 7 years to get to that moment.
What's up, buddy?
Yeah.
Doing good?
Yes, sir.
So what happened now?
I was in some fiddles, but I passed the test.
Wonderful. Great job. So what's left?
I just got to take the math one, and I took the GED test.
Great. Okay, so just the math and then you take their overall GED. All right, so how long can we get math?
I think in like 2 or 3 weeks.
Done. Ed,
I'll give me 3 weeks.
3 weeks. Hey, get it done, man.
Yes, sir.
It's proud. You can do it. You're in the home stretch. All right,
Baby steps.
go to it.
Sebastian, I'll talk to you before you go. Just the other important matter is Miss Barnett. She's the one that went into custody on a $10,000 bond on Friday
Oh,
that you brought back.
theft times
Yes.
50,000.
Yes,
Yes.
times 5, with a out-of-county probation. We were
Done
able,
docket today?
she was here on Monday, got the TRAS done, but we were
Oh.
waiting on the TRAS report.
Oh, great.
Here it is,
TRAS?
Judge, if I may approach.
Yeah, yeah.
So basically, it just said that it's a lot of drug usage. Issues.
Wow, guys, you made Kelly
They are
happy.
recommending
Whoa.
a
Thank you.
program. It's, I don't know about that.
Listen, when Kelly is happy, we are all happy. When Kelly's not happy, we are not happy at all. So you guys are amazing. Thank you.
I think that's a great idea.
Yeah, and I talked to her this morning. She's open to it, Judge.
She doesn't have to take it. I'm just gonna set her for trial.
Well, no, I know, she wants to.
Great.
It's just she doesn't know whether or not she asked if she can do it on her own. So
That's cute.
well, again, I told her that most likely that's not gonna happen. I gave her the pros and cons though, that if she's in, she gets first dibs and it's free and all of that good stuff.
Yeah.
So she's open to it, Judge, but of course,
So you didn't get subbed out, I guess, huh?
no, obviously there was a lot of talk, but I'm still here. So, if you want to talk to her personally, that's fine. I mean, or you just leave.
The Hue is a great,
What's that, Judge?
it's a great way to, hopefully straighten it out.
Right. I mean, I'm gonna ask you to revisit the bond again. If you say no, I can do is try. And then it's up to her.
Pavel,
Yes, sir.
she has 5 felony thefts upstairs.
Miss Barnett.
Barnett. If we put her into Hue A here today, think that would help anything upstairs or no?
I can't.
I know you can't, but
I was gonna say, Hui, if she has another pending court case in this one, Hui won't take her.
oh,
Yeah.
Oh.
So she does have to resolve the problems before she can lose. Well, she can resolve this today, but she has to get a job until she resolves the problems.
Correct?
I've already talked to her, so she's good as soon as she signs with you.
you might bring her up, please.
Yeah, so as soon as you sign up, you can go. Remember, practice. Judge, while we're waiting on that, can we multitask and handle Mr. Wright?
Okay.
Mr. Wright was the one that was testing positive for synthetic. And he was supposed to be here today. I got a text and an email from him. He is working, Judge. His job is at Labor Max, is at the warehouse. He's working there till 4:30.
What were you saying?
He's trying to put food on the table for his kids. I told him all I can do is approach to let you know what's going
Actually
on.
at work right now.
Well, I mean,
Telling me that he's at work out, I need some kind of.
can I try to reach him again? I've been trying to, and then if he,
Until the end of the time.
if he texts some pictures or something of him working at the warehouse, would that suffice? I mean, I'm talking about.
Be creative and show me what you got and then we'll go from there.
We'll wait for, and then the last one is Davis. Davis is a felony pending, Judge. He's here on an impeding, but he's got bigger issues with some aggravated stuff upstairs.
Oh, so he's in jail?
Yes, he's in custody.
Okay, yeah, whatever.
But he did wanted me to approach you and ask you for a PR bond, so.
I can talk to him about it.
Okay, thank you
If you
so
want.
much.
You, I
Thank
mean,
you.
that's where we're at. This one.
Good morning. How's jail? Good. The worse it is, the more likely you're to think about it next time, right? So you saw the report that the clinicians said, right? What they recommend. I think it's spot on, and I think that's a great pro.
Did you really just snitch on me and then say I'm bullying you? Is that, wait, hold on, I'm gonna scroll up for a second. Hold on. Let's see what Donald said. Beagle, Kathy overslept, and Fozzie hasn't let her forget it. And then I said, you too, Donald, you too? And there's Donald, who just snitched on me to everybody in the world watching. Just snitched on me. Say, see, Kathy is bullying. Kathy is bullied to us, Fozzie. He snitched on me, and then he called me a bully for it. You men Me and you all got to speak soon about reality, the world we live in. Because when you do something, you don't blame someone else for something. Oh, I'm sorry, Sue.
Program for you.
Ladies, whenever this happens, call it out like that. Give it to me. I'll put it on YouTube.
The only problem is that
This
your
is why I'm
5 felony
single,
cases
I think.
upstairs.
Maybe.
Put this on hold until those are resolved upstairs. What I would do is say next time, let me see. You have court in October. Perhaps you can ask your lawyer to speed it up a little bit. Let them know that with us, you have the ability to do Hue. And perhaps if they know that you're going to do Hue with us, they'll be willing to work with you on your cases upstairs. And that would be a great result, right? Understand that you're still on probation and it's Brazoria, right? So by doing all this, it still may affect your probation over there, but at least this is one step of trying to get it to where you think about the compulsive behavior, because it's repeatedly shooting yourself in the foot over and over.
Do you plan to make bond on the felony cases? Is your family still trying to bond you out there? Because, I've asked the judge to consider lowering your bond. Because right now your bond is set at the same as the felony, but this is a misdemeanor case, so
I don't think it's a good idea to let her out. You've been literally let out 6 different occasions, and they've reinstated your bond every single time, and you yet pick up an 8th case. No. On what alternate universe do you think that after 8 cases, we're still going?
This time it's different. This time it's different, Judge. Come on.
To give you a PR bond. You know what I mean? Really. Then it tells you it's okay to catch and release, and it's not.
But would you at least consider lowering the bond?
No, absolutely not. No. One thing needs to happen, and we need to get you into this program so you start thinking before acting, because it's killing you. Okay? So, I don't know, perhaps John D, you can reach out to.
Yeah, I'll try to reach out
If
to.
they'll
Absolutely.
put up and with
Yeah,
Hue,
we'll see what we can
maybe
do.
they'll really work with her.
All we can do
But
is
you
try.
can't do anything here until those are resolved upstairs. So I guess now let's set it for the day after felony. And then if they move it up, we'll move it up as well. John's here every day, so, okay,
Judge, if I can get that report back from you, make a copy.
for sure. Thank you, Ms. Barnett.
I'll talk to you.
Yeah, because I didn't get to read it. I want to read it. It's okay. It's okay.
Judge, we just have to visit Davis on the PR bond.
Okay, so do you mind having to bring out?
Yeah, I'll have, in the meantime, we can multitask. And
Hey, Judge, good morning.
Hey, what's new?
I am here with,
Whatever happened to Ayan Das?
he called me. He said that he missed my last message. He has a date that was supposed to be this month. He asked me to come before you so that we can make good on his promise. And he plans on getting a date. He said it this week, so I guess like Friday, tomorrow, so he can come back and address what needs to be addressed.
Does he need?
Remember, if you can, you put the warrant and said when he's ready to come back, you let him know, we'll let you know so that when he comes back, the warrant can be lifted and he can just come back from India. But he has every intention to get here first. I think he said his job.
No. There's a warrant, so don't try to come here first. If he tries to come here, they're gonna arrest him.
Yeah, that's why you told me to approach you about it.
Right. So
no, I'm saying that when he gets a date, it'll be more certain so that I don't have to come to you in vain and then we have to wait.
There's no vein. Just tell me, we can reinstate it, but I want a date that I know that he's right, and then I'll reinstate the bond for it.
Well, I thank you, Judge. I think.
That way we can get it to work,
My retainers run out, but he
It'll
will.
be our oldest case that we've ever worked on. Yeah.
Cause what is it, 20? Yeah, it's 20, and it's not a COVID, so it couldn't be the oldest.
No, that's still kind of
Oh,
active that
yeah.
will work through the system.
You let me off the case for a little bit.
Are you still on it or no?
No, he's re-upping his retainer, so. I mean, you asked. Okay, so I'm here because I'm making good on the promise that I told you that I would with my client coming to Miami. And don't get on the plane, drive here, get here as quick as we can.
Here?
Yeah, she's here.
Okay.
She is here before me, so your lovely
Remember
baby.
the Cosman? Is
So
it?
one of them is 2478756, 2478. Okay. So we've got 2 assaults stemming from the same incident with 2 complaining witnesses.
Ms. Ogunlowo, come on up, man.
You guys made fun of Skunk and Smuckers, but Ogaloa went right by you and you're fine with that?
Good morning, ma'am. Ma'am, you stand charged with 2 counts of assault. One of those is an assault of a family member. The other one is just a garden variety assault. On each of those cases, you're facing up to a year in jail and or a $4,000 fine. We're going to do probable cause. You have the right to remain silent. Anything you say can or will be used against you, excuse me. You have the right to have an attorney present. If you cannot afford one, one will be appointed to you. Okay, ready? Please.
On July 18, 2023, an officer responded to a family disturbance at 910 Cypress Station Drive in Harris County, Texas. Officer spoke with complainant 1 and complainant 2. Complainant 1 stated that his ex-girlfriend, the defendant, sent him several text messages to come get his belongings from her house. Complainant 1 stated that he and complainant 2 went to the defendant's residence. Complainant 1 went inside to retrieve his belongings while complainant 2 stayed in the vehicle. Defendant became upset that complainant 2 was sitting in the car and charged at it, holding pepper spray in her hand. Complainant 1 tried to stop defendant, at which point she pepper sprayed him in his face, causing pain. Defendant then pepper sprayed inside the vehicle where complainant 2 was sitting, which got on her arm and her leg. Complainant stated that she did feel pain and burning. Complainant 1 was treated for burns. The witness and security guard confirmed the incident.
Southern Laurel, I'm going to find that there's probable cause to go forward on both of your cases. I'm ordering you as a condition of your bond not to have any contact with the complaining witnesses in this case.
I would like to say that complaining witness and she shared 2 children, and complaining witness is here because.
Okay, we need to just verify that he wants to have contact with her, and if he does, well, I'll have the state speak with him. Okay, I want you to know that, so you're Desmond Simpson? Okay, I am issuing a protective order on behalf of Mr. Simpson. I'm ordering you as a condition of your bond not to have any threatening or harassing contact with this person, not to commit family violence, not to commit an act in furtherance of an offense under section 42.072 of the Texas Penal Code. She has an attitude. Sure you do. There's a stalking statute. You're not allowed to stalk this person, threaten, harass, use another person to communicate a threat or harassing behavior. You cannot be in possession of a weapon. This usually also comes with a residential restriction, meaning that you can not go within 200 feet of where he lives or where he works. If he does want to have contact with you, then we can amend it to where you can have no threatening, harassing, and kill the residential restriction. But understand, you are still on bond in this court. So we expect you to abide by these court orders, man. Would you mind speaking to Mr. Simpson, guys, to see?
We have DB prosecutors to see the case, Judge.
Okay. Now, about your bond, you have 2 warrants for your arrest at this time. Does she have any criminal history, guys? She has 2 pending cases.
No, just this.
Just this case, it has 2 charges. One missing.
So nothing else that you see? Okay. Ma'am, I will grant you a PR bond today, but I'm going to tell you, this is the only one I'm going to give you. If you start acting out there in the free world, I will yank the PR bonds and issue a warrant for your arrest. There will not be more, there will not be any more.
Okay, thank you.
Dude, you better get your sister, man, because I'm not putting up with it. I'm telling you now, you give me attitude, we're gonna have big problems.
Casey, thank you.
Judge, thank you.
Like, just try to do something nice, giving you a PR bond instead of making you pay a 10,000 and you still giving me attitude, man. Come on.
Attitude, sir.
You can't even look us in the eye. I will set the bond. So one is already set at 100. I'll set the other one at 100. Now we will grant her PR bonds.
One last thing, Judge, because she's going back to Miami, because that's where she's moved to. I'm gonna ask if I could get a little time to look at the discovery
Absolutely.
and then, okay.
So, ma'am, I'm gonna waive your appearance, meaning that you do not have to come to court. You do not have to show up while we wait for evidence to gather, but you must stay in touch. And she will tell you if and when you have to come back. If she tells me she can't get a hold of you because you're playing games and you're ducking and dodging phone calls, I will issue a warrant for your arrest. Like I said, if you pick up a new case, you violate these conditions, I will yank the PR bonds. I will not give you any more PR bonds, man. Okay, so I guess for now, we have to wait for the DV prosecutor.
It's
We'll
out.
have them interview Mr. Simpson. At that point, I will amend the MOAB to take off the residential restriction. We will just have her sign no threatening or harassing contact, no weapons, and then we'll send you on your way. I'm waiving the appearance anyways, so whatever reset you want, I mean, it doesn't matter to me, really, you know.
Well, thank you, Judge, I
For sure.
appreciate it. I would like to be excused and one more
Always,
stand down.
always a pleasure.
Always, and I'll be back real
Yes, ma'am.
soon.
Stay. But she also needs to do the PR bond with Rachel.
I lost my mute button for a second, but I found it. All right. Guys, thank you so much for coming out today. We're getting through this trial nicely. Soon we get to the good part. I used to only play the good part, but then everybody used to say, why aren't you playing the full trial? And just so you know, the jury selection, I got a few comments from people saying that was interesting. I've never seen that. So people like jury selection. Casey, thank you. Yes, there's Carrie. We're looking for Sue. We're looking for Sue to say something. Or, oh, it's payday for people. Yes. Yes. I love payday. Oh, well. Not Sue again. All right, Angie. Angela, Alexandra, Lee, Phil, and Kevin. Nope. Sue, your luck is just not good. Oh, yeah. Okay. Nope. I can do that now, Fozzie. I just got to find it.
Gonna come in. That's what's gonna happen. That's Murphy's Law.
Well, they only do Thursdays. They
See,
only-
and you wanted to put it on Friday.
Well, now we are gonna put it on Friday.
See, you will be here all day.
There's something did happen at the end here. I just can't remember what it.
You know,
I think it had something to do with Victoria. Thank you, Fozzie. Thank you.
so can we just keep you as a permanent floater then? Why not?
I mean, you can.
Well, right, I mean, that's what, I mean, I don't understand what the difference is. What's the flipping difference? You're working here now.
I promise. One, do you know Judge Guinea 183?
Yeah, yeah.
She had a meeting with the deputy director about it, and
the same outcome for everybody. So her whole thing was, I'm gonna vote it or I'm blue. I was.
What's the damn difference?
Oh, we went from flipping to damn. He must be really getting angry.
Can she get a degree in something between now and then?
Not for you.
I don't know. I mean, is there I guess, what is a degree? Like, what kind of degree do they want?
For you.
A 4-year?
Come on, Sue.
Whoa.
It can be in any.
Come on, Sue.
What'd you say?
Get to work.
Oh, no, we'll print one out.
We'll just use yours and cross out your name.
Yeah.
Amanda Panda. Yes, I did it. I did it.
Maybe a semester and a half left.
I did it.
But now.
Nico, I already did it.
Yeah, I mean, there's no,
Do
it's
that.
no sense in
thank
paying a
you.
bunch of money to go
Go
for,
back to that and I wanna.
when you're gonna do court reporting anyways, it just doesn't make sense. I don't know. Well, when we get closer to, I don't know.
But for now, they did say, cause I.
Actual
the second
lie.
was supposed to be my last.
Hello.
They were gonna switch me out with someone else, but then they extended it.
Great, until mid-October.
Ah,
Wonderful. Maybe they can extend it again. I'll do some begging or something. Maybe take some candy or bribe them somehow.
I don't remember. I'm gonna make a banner. I'm gonna make a short. I'm gonna make this my opening. V. What did I miss? V. We got V. We got V. Who's V? Tokyo, you're gonna need more words because I don't know what that means. Twitchy's green. I haunt you as green. Wow. Legal, you got some good ones. Oh, the Victoria? The one and only Victoria? Oh my goodness. Yeah, well, can't win them all. All right, Silver Fox, you're about to hear some bad words about me, but don't listen. Kathy was late too. How can I be late? I start the stream, so actually I can't be late. Only you guys can be late. I'm the one who can't possibly be late. And you know what? Sometimes I fall asleep. I was working tonight. I work every day, and I fell asleep. Okay, here's what really happened. So we have this new drink at work. And obviously, I mean, I can drink at work, but I can't drink at work because I have to drive home. So I had to bring it all home with me. Okay, Fozzie, you're going to have to breathe through this because you are not going to appreciate what I'm about to say. It's a vodka drink with cucumber and lemon, and it's delicious. And I couldn't stop when I got home after work because it was so good. So, so I fell asleep after. Oh man, it's really good. It's really good. It's like very refreshing. No, it's really good. I'm telling you. No, no, you're gonna have to drive here. If you drive here, I'll give you $5. Yeah, if you drive here, you have to drive right here. Unless I'm not here, then you have to drive to wherever I happen to be when you drive. Oh, that's why I fell asleep. Hi, Ad. Legal, the sugar daddy. So It's made in Pennsylvania. It's not a brewery. I don't know what it's called. Distillery. It's not a distillery. It's called Stateside. Anyway, it's called Stateside. And the good thing about Stateside is I know this is not legal at all, but they don't put any ingredients on their cans. None. So I don't know what's in it. Could be anything in this can. And it's delicious. It's just in Pennsylvania though. Cucumber. Just tastes good. I don't know if you guys have ever tried just to slice up a cucumber and throw it in some water and let it sit for a second or two, like 4 minutes, and then drink it. It is delicious. It is really, really good water. Legal. No, legal. It's too late. You can't change it now. Legal. We don't make the rules. We just enforce them. So take her bills and pay them, please. Yeah, Michael will appreciate you. Michael will. Legal. Don't you want Michael to appreciate you? Yeah, I wouldn't be home when he gets here though. I'll be gone. I'm never. Anyway. It wasn't. It's not ruining it. It's just good. It just tastes good. There's Kelly still working while we all stopped. We all checked out, I don't know, an hour ago. I don't know. I think the doctor killed it for everything today. But we had to get through it. I, actually, the doctor didn't kill it for everybody. We had some really good conversations in chat about medical stuff. Well, there's cucumber lemon. Used to be cucumber lemon mint, and I don't know why they took the mint out because that was very good, but it's still good. I love cucumbers. They're very, very yummy. So, I'm off on Monday. Not streaming Monday. Don't look for me on Monday. Hi, chat. What is today? Today is now Friday. Oh, thank God, it's the weekend. Thank God. Yeah, it was, and we had you and nurses in here to explain things that I didn't know, and now I'm horrified. I don't want to get my spine fused ever. Heck yeah, you did. Heck yeah. Nope. See, that's why I'm off because Victoria's not working. I ain't working. Every time Victoria takes off work, I'm not streaming. No, just kidding. That's insane. Kelly, that's insane. If I hit 40%, I'm tickled pink. Actually, do you want to know something perfectly honest, Kelly? Fozzie's really not going to like this. I have no idea how many likes I get on a video. I don't even look. I have no idea. I have no idea what percentage I usually get, except when you guys say stuff in chat and it like scrolls by and I look at it for a second and then I forget it. I don't even know. You guys work so hard for likes. And I mean you don't have to if you don't want to. I'm still gonna make the exact same video tomorrow that I was gonna make, whether I get a like or not. Fozzie's hyperventilating right now. Vegetables are water. Legal? They're water. Like, just eat them. It's all water. So is my beer. Mostly water. So it's good for me. Oh my gosh. You too? I thought we were cool. I thought we were buddies. And then you too? Are you gonna accuse me of bullying you? No problem, G-Man. It was probably Fozzie or legal or both or somebody else. It could have been anybody. You got a membership. Tokyo could have given it to you. Casey Carey could have given it to you. Could have been Fozzie. Could have been legal. Who knows? Who knows? I like pickles too, but I like cucumbers too. And I'm not picking one of them. Objection. I just want a plea deal. Time served. I just want to plead a time served. I want a PR bond. Listen, I might cut a little bit of the Smucker reader out. I might. You guys won't know. You didn't see the trial. Nobody saw the trial. Do you want to know how I know that nobody else saw this trial? Because it says how many viewers are viewing, and there was nobody but me. So I know you can't get this trial anywhere else. maybe I should learn from that nobody's watching this trial. So I shouldn't be. But the problem was I missed Cristofino. I missed him. So I just had to get it. Oh, Victoria, there's another oh no, I think it was 247th. There's another judge in your building that I like. And I'm gonna find her name. She's a little older. She kind of reminds me of our Judge Reese. You know how he's like older and a little cranky? That's how she is. And lawyers come and you know how lawyers like to talk. She doesn't like that. She's just like, they try to talk and she'll cut them off mid-word and say, okay, let's I gotta get her. I gotta get her. She's so cool. She's so cool. And I do have more Reese. But we have to get through this trial first, which I'm happy about. I'm very happy about it. Okay. I'm gonna hop off now. It is late. Jeez. Court's open in 3 minutes. 2 minutes now. It just flipped. I gotta get busy. I gotta get going. Guys, thank you so much for coming out. I appreciate it so much. I hope you guys have a great Friday. I will talk to you again soon. Bye, guys.
Got these hypotheticals, digital dreams. Through the screen, her blue eyes gleam. Wicked humor, sharp as a knife. Her stream sparks electric light. Late at night when the world sleeps, she's the friend that always keeps. Giggles roll like thunder loud. She stands out in any crowd. Kathy's laugh cuts through the gloom. Eyes blue like a summer's bloom. Her humor dark and twisted sharp. In a way, there's no alarm. Freedom tales waiting to the night. Her laughter feels just right. Even when my world turns gray, with a giggle, she lights the way. Her eyes near a sky so blue. In her jokes, there's a truth so true. With extreme, she brings the light. Turns dark days into bright. Kathy's laugh cuts through the gloom. Eyes blue like a summer's bloom. Her humor dark and twisted sharp. In a way, there's no alarm. Streaming tales waiting to the night. Her laughter feels just right. Even when my world turns gray, with a giggle, she lights the way. Kathy's laugh cuts through the gloom. Eyes blue like a summer's bloom. Her humor dark and twisted sharp. In a way, there's no alarm.